we're streaming. Welcome to the show. I think you guys know what the main focus of the show is going to be today, but feel free to sing along. Yeah, we start the show in about 60 and 35 seconds, something like that. 20, that sounds about right. Okay. And hi, chat room. Good morning. I'll try not to blitz over everything that's going on. Let's see. And then social. So I've been going back over the show for the last little bit and looking at the past episodes over the last 3 months. And some of you who've been longtime listeners, who've been a part of this show and a part of our chat room, and are embedded in our community, know that I've been mentioning the novel coronavirus since it came onto my radar as something serious in December, early December. And I went back over some of the shows, and as far back as um, February 1st, I was talking about the fact that this disease is now spreading, that it has 80% of the people that get it will have mild or no symptoms and can carry it asymptomatically. 20% will require hospital intervention. In that 20%, a quarter of them could perish from that. And this was details that were obvious to me and clear to anybody I mentioned it to 2 months ago. And so watching as the president flails through this Oval Office, his first Oval Office address, where literally in the middle of trying to say virus, healthcare, he's having heart flutters, which doesn't exactly make you feel confident about the state of the administration. And then knowing that he tanked the market down 2,000 points, comes out with a parade of individuals the next day. And comparatively, there was this feeling for about 35 seconds into it that, okay, well, this is more normal. He's declaring a state of emergency. And, this maybe somebody's talking in his ear about the seriousness of this, and he's finally gotten it, and we will shift onto a war footing towards this thing and handle it with the severity it warrants. And any of you who watched my live stream yesterday, and it's available at infotainmentwars.com, go watch as I broke down point by point as they went through this thing, almost live time. It was right after it. There were incredible moments of ignorance and ego and, well, Devin, what's the one, I think, the standout cue that you have in there? I don't know what the order is of the pieces we pulled in so far as clips, but pop up the one with the responsibility one right out of the gate, because that's the one that I think stood out for a lot of people. This is Trump yesterday being asked if, because he dismantled the Office of Pandemic Response because Obama created it. I mean, that's 100% why it's gone. The president came in and just started knocking anything, just vandalizing the policies of the last administration out of ego, and anything Obama did has to be bad, and I can do it better. And listen to the languaging around it and the absolute lack of responsibility for anything. It is as if the pandemic response team used to get him coffee and he hardly ever met him. Can we play that clip? Now hold it for a second before he answers, Devin. Hold for 1 second before he answers, because I like my it's not going through my stream, so I'll fix that in a second. But the baseline question there um, is quite normal. It is. There's nothing about this that, I mean, there's absolutely a pushback to some degree for on the thank you for the subscription. Just, it's a normal, like, hey, don't you think that not preparing for stuff like this puts some of the blame at your feet if this goes south? And here's his answer.
Well, I just think it's a nasty question, because what we've done is, and Tony has said numerous times,
I lost you for a second. My bad.
Thousands of lives because of the quick closing. And when you say me, I didn't do it. We have a group of people. I could ask perhaps in my administration, but I could perhaps ask Tony about that, because I don't know anything about it. I mean, you say we did that. I don't know anything about it.
But I'm not hearing it. That's the argument. Okay.
It's the administration. Perhaps they do that. People let people go. You used to be with a different newspaper than you are now. Things like that happen.
But this was
Okay,
this was an
please go ahead.
organization of national security.
We're doing a great job.
So, was that the end of the clip, Devin? Okay, thank you. Yeah, so insofar as the primary role of a president in this kind of a circumstance is effectively show his capacity for responsibility in a circumstance like this. And his first fallback is that I don't really know who did that. It's an administration, so there's lots of people. The idea that he doesn't know who or why is dismantling offices within the administration regarding pandemic response, that is, I mean, think about the leadership skills, baseline that you would expect from human beings, and the essence of, not only is he claiming not to know who people in his administration got rid of, in terms of, thank you, Craig, and Lisa and Hal Vickery, thank you so much. In the context of the people that he is, he's getting rid of, he's just basically saying, like, he said a speech a little while back, like, why are these people sitting around if we don't need them, if they're not making, if they're not doing anything? I'm a businessman, I don't like to spend this kind of money. Well, this is why he has multiple bankruptcies. This is why he has tens of thousands of lawsuits in his businesses. This is why he bifurcates all of his LLCs and subsidiaries of his family-owned company into smaller and smaller project LLCs for every individual thing, so that if that comes back to bite them because they have not prepared for any of the contingencies in the circumstance, it won't affect the main company. But you can't do that with citizenry. You can't do that with human beings. The level of lack of embarrassment by the people who support him, by the people who in any way seem to think that, I don't know. I mean, I think we have a crisis of leadership that a lot of us have been screaming about for quite some time. And it is almost as if the coronavirus is the example of, first they came for the Jews, then they came for the gay people, then they came for the disabled, then they came for me. And then when they came for me, there was no one left. That adage about racism and nationalistic state-sponsored racism, the idea that you don't recognize that COVID-19 is the fulfillment of that very mentality is horrifying. So over the course of this, show, we're clearly going to be talking about this. Louisiana has postponed their primary until late June, which is smart and going to be necessary. This campaign, which seemed like it was going to be relatively over relatively quickly, will have a lot of moving parts over the next couple of months. Biden made a statement, which I think is 100% why, after hearing that Biden was going to be making a statement, that he was putting together a team, Trump wanted to get in front of what Biden was doing. This is, abundantly clear. So he wanted to make an Oval Office speech as a kind of one-up with no prep. This speech was shaky and pathetic, and it is not as if other presidents have not made Oval Office last-minute, almost day of statements about, emergencies in the past. But usually there's a 24-hour lead up to, okay, this is a big deal. This is going to be a rolling issue. Therefore, let's make sure we get this right. So the next 24 hours, let's plan this for tomorrow. Today, we're going to work on and make sure we're up to date on everything. Start working on the draft of the speech right now. By tomorrow, we will have more specific details we will add into there. Thank you, Brad, for the super chat. I appreciate that, and I appreciate you guys being here with me today. I'm trying on my own on YouTube page to provide more just entertainment and edutainment, if you want to call it that, which is a horrible, infotainmentwars.com. We got the name because I was making fun of Alex Jones at one point, and I bought the URL, and it seemed appropriate. But in this circumstance, he was trying to get ahead of Biden's Biden coming out and saying he's going to put together a task force within his campaign to deal with this. And in trying to get ahead of him just on bragging rights, he basically leapt into the fire, nearly crashed the market, screwed up by riffing on his speech in the White House, in the Oval Office, and adding the fact that cargo would be affected, along with travelers, or people flying back would be affected by this ban, and people were racing to the airport and offering to spend $20,000 of money in a lot of cases they didn't have, just so they could be at home in case they got sick, in case a relative of theirs got sick. Can you imagine being overseas and knowing you have a relative that you're responsible for and you've only been away for a little bit, but all of a sudden you can't come home? How much of what you have left in the bank is worth it to make sure that you see them for the last time, or they see you, if this thing rolls forward like it looked like it is going to? And folks, it is gonna get way worse. And I have been talking about this. We're gonna take a break, but I've been talking about this since December. I have been mentioning the details of this since the 1st of February. All the stuff that's coming out now, like, this is the way we think it is, this is what we think is going on, this is, all the details you're getting from Pence and his task force right now is stuff that was readily available and quite obvious in the beginning of February. There is no excuse. We got to take a break. It's the House Sparks Radio program, mega worldwide on WCPT Radio, Chicago's Progressive Talk. Infotainmentwars.com is the website that takes you to the stream as well. But if you're sitting at home, listening to the radio, stay healthy. Order in, spray the bag with Lysol. We'll talk about that more when we come back. Now, I don't know why that audio wasn't working, and we'll see if it's fine. Okay, that didn't. Oh, this has to be added to. Okay. Let's see if I can do this one too. Korea. All right. Why does it go out that way? Who effectively. Oh, I see. The speakers are turned on this guy. Oh, Ecamm Live goes out that way. Such a weird thing. Oh, that's a plane flying over. I thought someone was playing scary music. I'm like, oh my god. All right. Okay, good. That's you guys are hearing my own voice. Chicago, did you hear that? Um, the, my voice, the QuickTime player. Let's see if I'll play it one more time. See if you guys can hear it. I've got a soundtrack now. Oh, why is that not going that way? I don't understand. All right, you're hearing me. That's fine. I'll try that again. Weird. I'm trying to send. Okay, I'll figure it out over time, but I can't for whatever reason send audio your way. Whatever. I don't understand. Um. Yeah, it's always an issue. Um. I don't know why it should be going out that way. There's no real reason why not. Mute when capturing. I don't even know what that means. Okay, maybe that did it. This nope. Okay, I'll play that stuff after. Oh, that'll be a post show thing where I can just bragging rights on having talked about this going back. The all right. And hi chat room. One second. I will be bringing you in on this in a little bit. So there is so much to this that has moving parts that are constantly changing, and a lot of them are crucial if you have any intention of I guess if you intend for people to modify their behavior and their life, up to date and honest information is the most crucial thing. People are going to be making decisions about where they go, who they are in contact with, what supplies they might need to stock up on, those kind of things. Which the toilet paper thing is it's baffling. And if you watched my stream from yesterday, I did plenty of comedy on that. But one of the things you need is up-to-date information. And right now, on the CDC's website, I would like to, I'll show it on the stream as well, but I'll relay it. Whoops, that's not what I want to do. The picture-in-picture, why are you showing that? That's not what I want. The issue, the CDC has a, let's see if I can bring it up here. Is that it? Yeah, there it is. So the CDC got a website up right now. That's cdc.gov, and there's all kinds of links to get this, what to do if you're sick, if you're at higher risk, those kind of things, whatever. This is nothing you're not hearing on every news channel right now, a little clearer. But the most stunning part of it, and people in the chat room can see this right now, is that it says coronavirus disease 2019 in the U.S., right? This is the up-to-date numbers on this thing. What does the number it gives us? 1629 total cases, 41 deaths. Jurisdictions reporting cases, 47. 46 states in the District of Columbia. Even still, they are being petty about D.C. At the top of the page, it says in red letters, updated March 13, 2020. And right below it says, this page will be updated regularly at noon, Mondays through Fridays. Numbers close out at 4 p.m. the day before reporting. The day before reporting. So the numbers that they're posting on Friday are from 4 o'clock the day before, and no numbers are posted on Saturday or Sunday. So the Friday numbers won't get posted until Monday, and the Saturday, Sunday numbers that will be included in that won't be posted until Tuesday, creating what is effectively an artificial spike on Tuesday. I mean, you can plan your financial and stock purchases just on that panic bump alone. Like that, I mean, there are tons of people doing that. This in and of itself is malfeasance. This is, and then we find out that the House has been negotiating with the Trump administration for a bill that he will sign and that will go through the Senate. They stayed late and voted on it last night, got it through, and Mitch McConnell sent the Senate home for the weekend. They will vote on it Monday. We are already 2 weeks behind minimum on our material response, a month and a half behind if you were a reasonable person who gave a crap and wanted to actually prepare. I mean, genuinely insane. Thank you so much, Chris, for that, for 666. This may be the end, so it's a good number to give. Yeah, and feel free to support the show, patreon.com/Hal Sparks. If you are a patron and somehow over the next little bit you are economically affected by this, please drop off and you can rejoin later. If you can help, only do it if it's outside your realm of need beyond a safety measure, honestly. Same thing applies to Super Chats and the things. I greatly appreciate that from you guys, and the support is incredibly helpful, and it does help the show, and it is necessary. But it needs, if you have to put it on pause at all, if it's even a hesitation, please know that's important. I have some strategies that might be something worth recommending to the business leaders in the world. And Trump in and of himself, like he brings out yesterday the heads of Target, CVS, Walgreens, and Walmart. Walmart and Walgreens got to go first because they have "wall" in the title. And then some people from medical companies who do medical supplies and pharmaceuticals and antiviral responses, and a guy from the home health industry, which is where most elderly people get their medical support, is by in-home intervention. Trump shook hands with the heads of the 4 biggest retailers in the country on camera. He could not stop touching the microphone. And all of the people from the medical companies that he brought up, and the pharmaceutical companies, and the suppliers, none of them shook his hand. It was the most distinct difference. And the one time he went for it, because they were obviously doing it, they were all turning away from him as they did it so that they would not have to have this, that interaction with him. It was super, it was super obvious that the retail guys are just used to glad handing. Thank you, DC257. Appreciate that. The retailers were like, business as usual. Business guys shake hands. It's a regular part of shaking hands. Trump even said it himself. He's, and it was right after, in the course of this conversation, and during these questioning periods, it was brought up that he had had interactions with people that had tested positive. And he's like, well, I haven't gotten tested, and I'm not worried about it. I don't even know the guy, and I don't have any symptoms. When everyone, including Fauci, had just said you can pass it asymptomatically, and you can be a carrier for days before you actually come down with symptoms. Now, I don't doubt, like I said, that the Secret Service or the White House doctor is jacking him full of all kinds of, antiviral antigens, whatever they have. That's like the upper echelon. Like the FDA isn't ready to test it on the public yet, but they've tested it in the field. Thank you so much, Billy. That maybe he's somehow magically protected because they have some super juice that they only give to world leaders. Maybe. That said, the man was drinking Diet Coke from a bottle right next to his desk during his address. For those of you that didn't see that, I did another video about that yesterday as well, and I can't play it because we can't play what he said on the air. because he F-bombed right before his speech while C-SPAN had his mic and his camera hot. Again, preparedness. This is so he's insisting on shaking people's hands. Do we have what are the other clips that we have of him, Devin? We have. Right. This is on. I'm baffled by the fact. Play. Let's see. Let's play the testing one if we could, for them. If that's available somehow. Hold on one second. Let me make sure that that's up and running. Yeah. Fire that up. See if we can.
Mr. President, thank you. I want to first follow up on Jeff's question because the person you were standing next to, whether you know who he is or not, tested positive for coronavirus. Dr. Fauci said this morning, if you stand next to somebody who tested positive, you should self-isolate and get a test. You say your White House doctor is telling you something different. Who should Americans listen to? And my second question
I think they have to listen to their doctors. And I think they shouldn't be jumping to get the test unless it's necessary. But I think they have to listen to their doctors. And I mean, I don't know I haven't seen the picture. Somebody said there's a picture with somebody taking a picture with me, but I haven't seen it.
Well, doctors have
but
said
I
you
can
might
tell
have it even if you don't have symptoms. Are you being selfish by not getting tested and potentially
Well, I didn't say I
exposing-
wasn't going to be tested.
Are you going to be?
Most likely, yeah. Most
When do you
likely.
think
Not for
that'll
that
happen?
reason, but because I think I will do it anyway.
Will you let us know
Fairly
the
soon.
results?
We're working on that. We're working out a schedule.
My second question, Mr.
You go
President,
ahead,
that was a
please.
follow-up.
This is it's like his taxes or something. It's like he thinks I will take the test after the audit is done. I will have an audit. And all right, we take a break. I have a couple of suggestions for both government and industry. These are we'll call them Sparks Simple Solutions. This is it seems self-evident. This is one of the ways that you can help people who are going to be economically impacted the most by this. We'll be back right after this. Thank you, Eve. Yeah, he announced, what did he say? He announced just now that he was tested yesterday. What a tool. Did they really just say that? Because I know Pence came out and said this. Social distancing. You must social distancing. Oh my God. What a cretin. Pence finally came out. Easy. You don't need a needle for the test. It's a swab. Tested last night, doesn't have results back yet. God. Who tested Larry Kudlow? Oh my God, he looked like crap. That was amazing yesterday. Like, social distancing is so important. Social distancing. I mean, it is mind blowing. Hold on, I don't know why my little chat window disappeared, but it's back. There you go. The second Ellen canceled has now been canceled. This is can you bring up Pence? Is Pence still speaking? I know he started right as I was starting, but Devin, are they? I'll see. Social distancing is so important. Let's see. On the bright side, Al, if everyone is stuck at home, you'll get a lot more viewers. Well, that's, I would rather it happen organically. I have no interest in growing viewership, but you guys have a home here. We will do a lot more streaming during these days because anything I can do.
We're back in 60, Hal, and you have 2 callers.
Okay. Let's see. So Pence just started talking. Twitter won't load. That's fun. See if I can.
This is Doris Davenport, host of The Doris Davenport Show, all local, all the time. Now let's get back to Hal Sparks' radio program, Mega Worldwide.
So Pence
To
is
the
talking right
coronavirus,
now.
but a whole of America approach.
And
The focus of our task force today and going forward is on implementing the president's public and private partnership,
the fact that
on
the
testing,
president somehow thinks
focusing on ensuring
make
that
people
state
feel better
and local authorities
ridiculous.
have the guidance.
every time they stand up there, they have a fixation on making sure that there is someone from the economic world right over the shoulder of them. Mnuchin is standing there right now with Pence as he is talking. They've got the White House doctor, which is apparently the guy telling Trump he doesn't need to be tested. So I don't know where they get these guys. But before I lay into them, and by the way, they're saying they're now temperature checking reporters and other people who are coming in contact with the president and the vice president. But apparently Larry Kudlow managed to get by. I mean, he looked like death warmed over yesterday, or day before yesterday. Like it was madness. So here's my suggestions. A couple of things right away. It will be increasingly difficult for people, landlords and mortgage companies and other groups to, and phone companies, cable companies, internet companies will start losing payments in mass very soon. I know of an entire warehouse full of people who were just laid off. They will have their check for the month, but if they don't get their jobs back in a month, at the beginning of the next month, and at some point they don't have an extension of at least enough unemployment insurance to meet their bills. When in a situation where you need internet and cable more than ever to keep track of the arc of reality around you, where you can't buy a 25-cent newspaper that it will keep you informed every day in most places without going out, especially, and who gets them at home. Having a working phone and internet and cable and being able to pay your rent and your mortgage become really a desperate aspect of modern life. My suggestion would be, and any Democratic lawmaker within the sound of my voice and any administration official who is looking for some of these solutions, is to suggest to the Verizons, AT&Ts, Crickets of the world that a suspension of payments on phone bills for the next 3 months and prorating the cost of those phone bills over the next year. So these 3 months, no bill until June, let's say, reevaluate then. But March, April, and May, no phone bill, no cable bill, no internet bill. And then taking a slice of what you would be paying by percentage, 5%, maybe 10%, depending on what people can do over the next year to level that out. That seems a reasonable response. It does not mean that they have to give free service out of nowhere. It doesn't jack up the use of those things or whatever. But prorating the amount that you would pay over the next 3 months, which is the crucial time and the impact point, as we're all, self-quarantining, people can't go to work, all those kind of things that are greatly affect people, especially people who are wage employees. The telecoms and the internet companies and the cable companies, this is one of the ways that they could make a vast improvement on the lives of their customers and show that they are part of, that we're all in this together, as the president said. 3 months, no payment, prorate out over the next year. That is not a difficulty for companies this big. They will also, I have no doubt, if they choose to do this, will get some form of support from the federal government for payroll, for the current billing for the people that they have to employ to keep the services going. Yeah, it would be great telecom PR. So, if you work for Verizon, AT&T, Cricket, any of these things, if CEO of those companies or whatever, I recommend this as a strategy. Simply implement, don't even offer it. Implement 3 months free of charge phone and smartphone internet service for your customers till June 1st, and the cost of those 3 months will be prorated over the next year. And then, call up the lawmakers and throw out your lobbyists and go, we just need support for the people we're going to have to pay through these 3 months. Profits can wait, but we've got to pay the employees to keep this stuff online during these times. And if we're not taking any fees from our customers, we need funds to keep those people employed. That seems reasonable. And somebody was saying Comcast is offering free internet for 60 days to low-income residents due to COVID-19 in Washington State. Too narrow-focused. I think you go nationwide with it. That's crucial. Sorry, did somebody roll through there and I missed something? In the chat room, I just want to roll back. So that's my suggestion on that. The same thing can apply to renters, that the government can give bridge loans to people who rent, to people who own apartment buildings and whatnot, that will say, okay, act as if you're being paid rent for the next 3 months. We'll pay that part of it, and you can, and basically prorate this out over the next year, the minimum on it or whatever, just so that people aren't getting kicked out over the next 3 months. Now, it won't be this month or the second month that will be the problem. When all the economic rolling effects of, as far as rent and all those kind of things, they will start to hit a critical mass around May and June because of the rolling impact of this, because people who are laid off or fired will get severance or something most of the time, or can get unemployment right away, and the bill that's passed the House will allow for that. So that should cover rent and some supplies. The extension of food, like SNAP and all those kind of things. And I urge you in this circumstance to, if you even are remotely on the edge of needing it, use it. And use it temporarily. If you don't need it at all, encourage other people to get it if they do. Shame is a factor in people not using services that are made available to them. If you're a small business and he's like, we're flooding the Small Business Administration with cash, the first people in line will be the first people he called in the SBA world who will jump in there and take this money. Now, we got to take another break. When we come back, I'm going to take some calls. Two things to think about during the break. One is the $1.5 trillion infusion that was put in day before yesterday that actually hit the market and was partly responsible for the spike that you saw. largely responsible, that and the declaration of emergency, is a lot of people have been tweeting about, oh, well, we can afford this, but we can't afford to pay for schools and healthcare, and this would be part of the, okay. The 1.5 trillion is short term and has to be paid back immediately. Healthcare, education, all those things, that's funds that go out the door permanently. So comparing them is unwise and hyperbolic. It's not the same thing. That $1.5 trillion is basically bridge money, bridge loans that have to, get you over a hump, but then you have to pay it back fairly quickly. And if you don't, if it extends out, you start paying interest on it that's exorbitant. It's almost like giving somebody a 21% credit card, but saying the first 2 years are free, just to keep them, in a purchase cycle. That's what stores do. That's what the government's doing with business right now. They have to pay it back. Healthcare, all those programs that we're fighting for, that money, it's just apples and oranges. It's not a comparison. Just to put that in there. So, and we've got to take a break. We'll be back right after this.
Hi, I'm Jay Farner, CEO of Quicken Loans.
You feel broke right now? All right. So, hold on. Why is Ben Carson standing next to Tang? He's a doctor because he's a token black. Yeah, well, I would think both. Hold on.
Like my 88-year-old mom. Let's look after seniors with serious underlying health conditions and make sure that every American around them is practicing the best kind of hygiene, the best kind of measures to ensure.
Trump is a senior. Oh my God, what is wrong with? All right.
Surgeon General, and before we wrap up and take some questions. With that, let me recognize Dr. Tony Fauci for an update on where we stand and recommendations and guidance.
If Tony Fauci gets sick, it's over. They have been parading this guy as the hope of, everybody's like relying on him in the administration as the voice of reason and normalcy. If he starts coughing, we're screwed. Honest to God, because he's become an emblem of it. He calls his wife mother and his mother mom. I know, it's so weird.
1,000 or 81,000 new cases, but only 11 new cases and only 7 new deaths. Things have switched over now to outside of China, which is the decision of the president to do the travel restrictions in other areas besides China. And I think it's important to recognize that, because when this is all over and it will end, you will see a curve of...
Oh, don't tell me about the curve, dude. He loves that curve idea. It's just embarrassing. I don't know why this doesn't want to play it. So I'm gonna cut this. Why is that on? Hold on. Can you hear this, Devin?
And 9 new deaths, which means we haven't reached our peak.
It's supposed to go through there, but it's not doing it. I don't know why. All right, never mind.
This is Tom Hartman, and you're listening to the Hal Sparks radio program, Mega Worldwide on Chicago's Progressive Talk, WCPT.
Trump said last night, I also took the test last night. I decided I should based on the press conference last night, which was not last night. Okay, whatever. Mr. Trump said the president has repeatedly questioned whether he had taken a test during a press conference Friday, which was during the day. He was outside. The sun was up, but nighttime. Okay, this is literally where the president is. Last night when we were in the Rose Garden and that big yellow thing that I stare at when it's eclipsing was out at night, I said I would take it in a very short order of time. And then Trump also praised members of the task force, saying, we've created a number of new stars. The ego is embarrassing. Okay, let's take a couple of calls. Let's see if we can talk to some folks about this. And I appreciate you guys in the chat room being with us. I'll also focus on some of you guys in a minute. I want to bring up some of what you're saying as well. Who do we have, Devin?
First, we have our good friend Roosevelt's.
Oh, right on. Hey, Roosevelt.
Hey, how you doing? Good morning. How you doing this morning?
I'm good. Go ahead.
Hey, listen, did you see the first tweet that Trump had this morning?
I don't know if it was the first one, the social distancing, that one, where he just screamed social distancing.
The one about the stock market, that the stock market at all-time, yesterday was an all-time high as far as the stock market, and they debunked that because it's the 8th highest.
Yeah, and the 8 worst drops in history have happened under him, and 3 of them in the last week and a half. Like, the man is hyper fixated and panicking, and you could tell that he has lashed this stock market to his presidency. This is the poll he cares about. The poll that exists that tells Trump he is doing a good job or not. His approval-disapproval rating is the stock market to him.
Right, but he's not going to tweet about that, Hal. Now let me go back to yesterday for a minute. And I'm not going to take that long.
Sure.
What I was focused on was Trump's hands. He was the first person that came down, the first person that touched the microphone with his left hand, the same hand that later on he used the index finger under his nose, just like my kids when they have a runny nose.
Yeah.
And he kept on touching the mic because he's taller than Fauci.
Fauci, yeah.
Anthony Fauci. Yeah, and he also touched the mic. So potentially he got everybody coronavirus. Potentially all the people that are in charge and protecting, supposedly looking after us. And I believe the lady, the blonde lady, I can't remember her name.
Yeah, the woman from the CDC, she did the same thing, right?
She did the same thing because she's taller than Fauci. So here's the thing. To me, it was a Muppet show, and I'll tell you why. That particular lady was behind Trump. Anything Trump said, she kept on nodding her head up and down, up and down. But getting back to Trump's hands, he constantly touched the mic.
Yes.
He already reported on the big shots from Walmart, Target, Walgreens, you name it. But
CVS, they all shook hands with him. And all the medical guys, though, were like dodging it. You could tell they were walking up. They left shouldered him, meaning that they walked up no matter what side they were from. You could watch their body language. They walked up and they put their left shoulder to Trump, like kind of walked and turned so that their right hand wouldn't be naturally extended, so that the social norm of, oh, your hands, you're walking towards me, therefore, so they wouldn't have to turn it down. And the one guy who did kind of find himself in that position was the guy from the home health care industry who was the first person to give the elbow to Trump. If he had spoken first, Trump would not have shaken hands with the rest of the people. The fact that and this is so Trump, the fact that they brought up the retail people first and the medical people second is indicative of his priorities in this circumstance. Had his priorities been reversed and he understood the importance of this, the medical people would have spoken first. None of them would have shaken hands with him. The dude from the home health thing would have given him an elbow, and all the people from retail would have done the same thing. I mean, literally, you're watching just this like mayor of Shark Island nonsense in real time.
And hell, is it just me because I hate the man? I'll be honest with you. I hate him because of the fact of what he did to this country, what he's doing to the youth of America, which is our future. But is it just me? Tell me it's just me, and let me tell you what I'm talking about. Does Anthony Fauci, when he talks in front of Congress, he's a different person. When he's in front of Trump, he makes excuses for Trump. I was very disappointed in him. I was saying, oh, he's the authority. He's the guy that knows the most. And he's a different person when he's in the presence of Trump. And to your point earlier, when he spoke from the Oval Office, you know who wrote the speech for him? His
Stephen Miller. And
son-in-law, Miller.
Yeah.
And Miller.
Jared, Ivanka, and Stephen Miller. If you watch yesterday, I showed where he spoke before and after his speech, when he swore and when he was like trying to decide whether the speech should be a folder should be on the desk with the speech in it, or whether it looked better off to the side, like it's a prop. The reason you have the speech on the desk is in case the teleprompter goes out in a live situation and you're talking to the nation about something serious, you can go, excuse me, we've had a technical difficulty. You open it, you go to page 4, that's where we were, somebody's there to tell you. They'll do that. If a teleprompter goes down, they'll go 5, which means page 5. You open it and go, excuse me, we'll continue. And then you read from the speech that's on the table. That's a precaution. That's looking forward that there might be a technical difficulty and preparing for it. It's indicative of how he's handling the whole damn coronavirus situation. He can't. All right. Yeah.
Hell.
Go ahead.
I'm going to close with this. Fauci, I've been getting used to Fauci's voice. Again, is it just me, or does he sound a little raspier now? And
yes.
Right now, I'm looking at him live, and he just swiped away his nose with his elbow. Not with his elbow, with his
sleeve.
With his sleeve. Exactly.
Yeah.
I can see him right now. So you tell me how.
All these people have been like a festering cesspool of asymptomatic viral spread for days now, and because Trump wants this show of force idea for both. To show, the steadying factor that we've got a team together that's handling it now, instead of going, hey, we've got a team together, but we're keeping them separate because we're taking precautions that you should be taking. Like, nobody in the country cares that there's a wall of people right behind him. Nobody. And yeah.
One more thing, Hal. Has anybody in the federal government addressed our troops that are in Afghanistan? Because I've heard callers on the station saying that they got family members,
right?
And there's some of those kids are running in fevers and coughing. Nobody's addressed our troops. These people that say that they're behind our troops, none of them have addressed that. Yeah. And I'm curious about the fact how many of those kids have this coronavirus, because it exists in Afghanistan also. Maybe the numbers are not high. Maybe the numbers are not that important. But there are symptoms of kids that they may have this potentially.
Right.
I don't.
Well, and that's why, it's funny. We're in the process of bringing troops home. That is going to be necessarily delayed, because if they are infected and it's spread through bases and stuff, while they might not be, because they are young and healthy, may not have a really bad infection based on this. They could bring it home to the parents that haven't seen them in a year or more.
Yep, that's what I'm getting at, Hal. Thank you for taking my call.
Absolutely. No, I appreciate you calling in. And we got really close to the break, so I'm not going to take this next caller until we come back after the hard break that we have coming up, because I want to give them time to speak. So if you're there, hang on. 773-763-9278 is our number. Patreon.com/Hal Sparks. If you can at all support the show, like I said, if you are a patron and it's going to get tough for you, please step back. There are no hard feelings. I love you guys, and I love the fact that you support the show. But I'm more comfortable with you guys. If you can add an extra cup of coffee, if you can afford an extra cup of coffee and you want to help the show that way, because that's about how much the baseline Patreon support is, great. If not, please don't. And the same thing applies to super chats. And I really appreciate you guys who've been super chatting all day today. One of the ways you can support the show, if monetarily things are going to get tough, and they very well may, and I'm rooting for you guys, and we will try to be part of the solution in this. Just like and subscribe, share the show. That's plenty. I adore you guys. We'll be back in a minute, in about 5 minutes after we do these, and I'm gonna see if I can bring up some of what this live nonsense that's going on. I just have to say, I think they're doing more harm than good by even being on camera. At this point, all we need are details. We don't need any of the pep talks from these idiots. It's embarrassing. We'll be back. Man.
All our operators follow that suit. And then we have also given orders to a very small handful to not sail, and that began at midnight last night as well. Today, as the Vice President outlined, the President made the decision due to the rising number of cases in the UK to apply these restrictions to both the UK and Ireland. So as we move forward,
I'm glad this guy knows the difference between UK and Ireland. The president didn't.
Been present in the UK or Ireland in the past 14 days. And again, that goes effective midnight Monday.
So you got 2 days. If you've been in the UK or Ireland, you got 2 days to fly to the States. Why have a travel restriction if you're not making it effective immediately? If it's not effective immediately, it's not a travel restriction.
And then we have other exemptions that are outlined in the proclamation. Can certainly travel back to the U.S. They will undergo some medical screening and some other questions when they arrive, and then they will be asked to self-quarantine for 14 days. These restrictions to the UK and Ireland, just like the Schengen zone in China and Iran, do not apply to cargo and economic air cargo, maritime cargo, economic shipping, or the like.
Yeah, notice how they had to say
Let me
that.
close again by saying that the president has really taken unprecedented action to protect the safety and the security of the American public.
No,
these actions
he
have
hasn't.
never been taken before. And so
They've never been needed before. We haven't had a sprawling infection rate like this before. And one of the reasons why he's having to take them this drastically is because they didn't take them early enough.
That we do this in a very orderly and efficient process.
Yeah, right. That's because that's what's happening.
Measures on the table.
This is Chicago's
to implement as we go forward as the virus continues to evolve. So thank you.
Don't use the word evolve, dude. The situation with the virus continues to evolve.
Your thanks and commendation to the dedicated men and women of DHS that are on the front lines of implementing these travel policies and doing an outstanding job. With that, I'm going to recognize Seema Verma, the head of CMS, to talk about our continued emphasis on seniors, and particularly the risk to seniors with serious underlying health conditions, and the steps that we're taking relative to nursing homes and inspections and guidance.
You're taking the same steps that Seattle and everywhere else has taken, but you're just taking them a week later. Like, this idea that they're the genesis of any of this garbage is nonsense. Hi, Gene Kelly. Thank you for subscribing. Thanks to all the new subscribers who are coming in. I appreciate you guys, too. Yeah.
Now, there are some exceptions for end of life. We're also canceling all group activities and communal.
Yeah, if your relatives are already in hospice and they're dying, you can go see them. If your relatives have a chance of living, stay away from them. Postpone the trip and figure out a way to start FaceTiming. And senior centers, this is another suggestion. Senior centers should start offering FaceTime for elderly people in their care with regularity if the patients don't normally have access to that. Bring in some iPads, call all the people that have, all right, I'll mention this on the air because it's,
For our surveyors, and we have already begun the process of going into nursing homes, especially the ones that we that have had a history of problems with infection control. And those inspections have already started. We've been doing those in Washington State, in California, New York, but we'll be increasing those over the coming weeks. Thank you.
Thank you, Seema. And I'm mindful of the fact that there are likely many seniors in nursing homes around America that could be watching us at this hour. And let me just assure you that we're going to continue to take steps to ensure that all the guidance from CMS, all the guidance from CDC about preventing the spread of infectious disease remains low. And the threat here, I want to be clear, as Dr. Fauci has said, and I might just ask him to emphasize again.
Dr. Fauci, come up here again and touch the podium I just touched after I shook hands with the president 65 times this morning and after you wiped your nose on your sleeve because you've been around all these people and we won't let you leave the building and we didn't test the president until last night and we won't know if he's, come on up.
Most vulnerable, but to all of those other seniors that are watching from nursing homes or maybe watching from home or otherwise healthy, Dr. Fauci, maybe you'd give them a word.
Yeah, sure. I think that you.
All right, we're back in 60, Hal, and you have 3 callers now.
Oh, okay. Man. The ignorance.
It was when you're 30, but if you're otherwise healthy senior, that the things that you really have less of a risk than if you have an underlying condition. Thank you.
Nodding. Yes.
updates for you.
But you're in contact with other people. Okay, God damn it. If you're a senior in one of these senior centers, or you interact with someone who is, you have an older spouse who's now in a home because they need the care, and you visit with them regularly, but you're relatively healthy by comparison, you visiting them, you could pick it up and carry it, even if you're...
And some straight talk from the nation's doctor. We really need you all to lean into and prioritize the health and safety of the American people.
You're listening to the Hal Sparks radio program, Mega Worldwide.
I've had people walk out of me before, but not when I was being so charming.
Video streaming at halsparks.com.
I don't care for you or for the putrid sludge you're troweling out.
Puss-faced little pimp stick.
True progressive talk.
Might be a good time for you guys to give up.
So Trump says, I think is the big quote about the coronavirus, I think, that really shows the depth of his understanding and caring in this is, we want to get it over with quickly and with very little death. Like, what? All right, we have a bunch of callers, and I want to hear from you guys on this. Who do we have next, Devin? Who's been hanging on for us?
Next, we have Bob out in Chicago.
Hey, Bob. Hey, Bob. Welcome to the show. You there?
Hey, Hal.
Hey, Bob.
Take you off speaker and put the
ahead.
phone right next to my ear.
Right.
I just want to say one fact that I heard this week that I think everyone should know and remember when Trump is talking.
Right.
South Korea and the United States diagnosed their first case of coronavirus at the same time. And just look at the difference.
Right.
And what has happened since then. It was within 24 hours of each other that we each got our first cases.
Yeah. And, by the way, every time they say, we've had an unprecedented response to this, it is record, unprecedented, there is a precedent. The precedent is South Korea. South Korea set the precedent. They had it almost the same time we did, and they have set a precedent for how you handle it and how you bend the curve. And we did not.
I understand China's different because they're a much stricter government, so I understand we can't compare what they did to us, but South Korea is a pretty fair comparison, and every time it says stuff like that, it drives me nuts.
Yes. And Italy, we are closer to Italy's response period. Now, Italy has a particular vulnerability that the United States doesn't have in some ways, in that they have extended families living at home. So there's a lot of multi-generational living and a lot of elderly people who live a very long life and who have smoked forever. Like, it's amazing to look at the elderly Italians who are in their 80s and 90s who smoke and eat wine and cheat. Like, everybody's baffled by the fact that they dodge every recommendation that we've ever been told about diet and health in this country. But they all live there, and so the kids get it, or an adult gets it, brings it into the home, it spreads throughout, the kids interact with other elderly people on the block. That social network, which is part of the vibrance and beauty of the Italian culture, is the very reason why it spread as quickly as it did. And Italy and South Korea's health systems are quite similar. Italy has a single-payer system. South Korea has a similar, supported system, closer to what the Netherlands has. But it's not like these are countries where people are afraid to go to the doctor. That's not the problem. And look how bad it hit there. Right, go ahead.
Per capita. Right, that's the thing, that if we follow their path, we'll be even more overwhelmed, our system. So.
Because of that delay. I mean, and we have, I appreciate the call. It's a little choppy, so I'm going to let you go, but I appreciate you calling in and bringing that up. Let's grab the next caller, too, because then I know if I start, I'll get on a rant, so I want to make sure we get people in.
Next, we have Old Bob out in Indiana.
Well, there we go. We as long as we have the range of Bobs, I'm good. Hey, Bob.
Good morning or afternoon, whichever is the most apropos for you.
We are Mega Worldwide. It's almost everything, so go ahead. I appreciate it.
Before I forget, I just want to say that the repairing of you with Steffi Miller has really boosted morale for the Allied cause.
All right. Well, I appreciate that. It's nice to be back on there. I was supposed to fill in for her on Tuesday because she was going to go visit her mother, who is 96 years old. And I said, when I was on the show last week, I was like, don't. You can't go. And she ultimately decided against it, which I'm glad about. I don't know if I'll end up calling in on Tuesday or what'll be the deal because I'm in Vegas right now. But yeah, it's been lovely and it will continue and we will still have shows. We've postponed Madison, but there will be more of it. Go ahead, though.
Well, if I'm understanding this thing correctly, and as you said many times, I'm not that bright, but using our pinkies, as we all do, that's a large way to both spread and get this ailment, right?
Mm-hmm.
Then, I'm here now in the Michigan City, Indiana area, wherever the hell that is.
Right.
And I know I'm not alone.
No.
But you can't find hand sanitizer anywhere around here.
Right.
And I'm thinking, shouldn't there be a crash course, a program by the government to get that stuff out on the shelves and keep it there?
Yes, there's been de Blasio was saying that on TV today that any factory or any group that can make it should be, the government should, order a bunch of it to restock shelves and the like. Again, it has to have 60% alcohol or it is completely ineffective. You're going to see a lot of dumping on the shelves of stuff with less than 60% alcohol in it. Washing your hands is always better. In the interim, there are all kinds of secondary, like sanitary hand wipes and the like. You can carry those instead if those still are in stock. I've noticed that the spray bottle version of hand sanitizer seems to be in stock in a bunch of places because people go for the liquid automatically. They buy it out, and I've walked by shelves where the spray hand sanitizer, which I have a few of, are still in stock in places. You can make your own. I think it's 2 parts aloe vera gel, 1 part isopropyl alcohol, and mix it and put it in your own bottles and use that. Washing your hands will always be the difference. The crucial thing over the next 2 weeks is social distancing. Period. Staying at home if you at all can. If you cannot, then you've got to take extra precautions, and that means using your foot to open doors, only going in stores that have automatic doors on them, staying away. This is incredibly important. And even if you use hand sanitizer, by the way, you have to rub your hands for 20 seconds until it's completely dry and it has evaporated effectively and gone over your hands for it to be effective. You can't just slap it on and then that's it, and your hands are still wet from it. You need to spread it around your hands just like the 20 seconds in washing your hands. But yes, you're right. We should have stockpiles of this kind of stuff in a multinational country like ours. We are, like many other European countries, the crossroads of the world on so many fronts that this should be a natural part of how we prepare for these kind of situations. We know that there will come, that we know that they will get more virulent. We know, the flu kills enough people, and we already have herd immunity and a vaccine. We have none of those things, and it is incredibly contagious. So the important thing is to break the contagion cycle by staying back from people as much as possible, especially if you're vulnerable, especially if you're older. And if anybody can, yeah, go ahead.
That's where I'm lucky. I'm 68. I've got diabetes and heart trouble, so I have to stay home most of the time anyway.
Right. Well, if you're going to order food or order anything delivered to your house, have them leave it on the stoop. Don't grab it out of their hands. And if you have a can of Lysol, do yourself a favor and spray the outside of it, or pick up the bag with a paper towel. I know I'm sounding overly cautious about it, but I genuinely mean it. Just take those extra steps. It may not be necessary, but better to err on the side of caution. And then just that little act of just spraying down the bag itself will help, because it can stay on some surfaces for 24 to 48 hours. The other thing is order something you need, and the day before you'll need it. And if you got, if you're ordering food and the like, don't order expirable, things that can expire in a couple of days or that need immediate refrigeration. Order like cans of stuff and just let it sit for 24 hours. Let it cycle through until you need it. You know what I mean? Get ahead of that curve if you can. And if you go to the grocery store, like I said, social distancing, keeping your hands clean, and using self-checkout, if they wipe it down regularly, might be your better bet. That's my advice. So, but take care of yourself. Stay healthy. If you, again, this is one of those things. The next 2 weeks will be very critical, and I'm pulling for you. So, call us back next week. Let us know how you're doing, because I'm going to be thinking about you over the course of the week. I have no doubt. We have to take a break. We'll be back. Sorry, say again? Say again?
I'm thinking about you too, and everybody else.
Yeah, well, I appreciate that, old Bob. We love you. Stay healthy. We'll be back right after this. It's the Hal Sparks Radio program, Mega Worldwide, on WCPT Radio, Chicago's Progressive Talk. Did Trump come out at the top of this Pence thing?
President, thank you, Mr. Vice President. Could you give us more details on the potential financial assistance for the entertainment industry, for the cruise industry that the administration is looking at right now? And if I may, on the temperature checks, were all of the members of the cabinet who were in here today, did they also have their temperatures checked? And, okay, I see you nodding, but is it also the White House policy now that anyone who, for instance, comes into the Oval Office needs to have their temperature checked at the door?
I'd refer those questions to the White House physician's office. I have been informed that they're establishing new protocols for temperature checks. And
good God. So let's be abundantly clear. The temperature checks that they're doing are good, and they should be doing that or whatever. But if somebody does not, you're going to say something, Devin? Yeah, we're back in.
We're coming back in 60.
Okay, great. Yeah. What happens if the fever spike on this is fairly short-lived, and in some cases is a minor spike that people don't even recognize as being one of the major symptoms of it. So if they weren't checked before and they're just riding out the other stuff like it's normal flu, and all these sniffly people that have been around and raspy throats and minor coughs that are going on. I mean, God, this is like a horror movie. Like all these people, it's like watching people going, there's a slow rolling zombie apocalypse happening, and the vice president in the middle of it starts going, and his eye turns red, and, after a piece of blood drops in his eye from a crow in a tree. This is, yeah. Anyways,
where we have shut down travel and
things aren't playing, just go.
Yeah. Welcome back to the show. It's the Hal Sparks Radio program, Mega Worldwide. We're going to be doing a lot of extra streams on my YouTube channel. Infotainmentwars.com is the link that gets you there, the easiest. Give us a thumbs up, like and subscribe, all that kind of stuff. Stay tuned. I will, anybody who listens to this show regularly knows I've been rattling this cage and waving these red flags for months, and I'm glad people are finally catching up to the severity of this circumstance. But for God's sake, an abundance of caution is necessary. That's what will stem the tide and lower that arc that that Fauci is talking about. It will help level out the curve. And drastic measures right away help a lot more than soft rolling them over time. I was supposed to go visit with take my son's spring break is this week. And I was supposed to take him, he's with his mom right now, and I was supposed to take him to see my dad for a visit because my dad's supposed to have surgery. I can't do that now, and I will not do that now because there are cases here, there are cases in Seattle where I just was, there are cases in Los Angeles where I just was, there are cases in Kansas where my son is, there are cases in Kentucky where my dad is. And so this whole throughput is very dangerous. That even if I don't have it, I could bring it to him, and we could bring it to my dad. Even if we don't, there in northern Kentucky and Ohio near Cincinnati, there are cases. We could totally safely, conceivably, go visit my father and not have it, and him not get it from us, and then we could pick it up on our way back and spread it to 2 different states because we've gone there. That's what I'm talking about. And I have to tell you, to all the parents with, dual custody that requires any kind of travel, even across town, my heart goes out to you right now because I know you are making tough decisions as well on the time that you are spending with your child and that they are spending with you. That cascading effect is incredibly heartbreaking in and of itself. These are all the ancillary effects of this kind of necessary social distancing and quarantining, self-quarantining that goes on to stop this from going. But this is necessary so that people have futures. So anyways, let's grab another caller because I think we had a couple still on the line. Who do we have, Devin?
Next, we have Catherine out in Oak Park.
Cool. Hey, Catherine. Welcome to the show.
Hi, Hal. Actually, just as an aside, I have an ex-husband who lives in the same town as I do, and I had to actually try to really impress upon him that he's just not somebody who was getting this crisis, and his company had not, until yesterday afternoon, they had not mandated working from home. Finally, they did.
Right.
But I was telling him earlier this week, can just do it, make sick days. I don't care, because his behavior affects my child and me.
Right.
And
yes.
I was telling him to start going to the grocery store. People were acting really irrationally, and there's not. He didn't even get that there was no toilet paper left. He's clueless, right? So It's amazing. Even if you try to detach yourself from somebody after divorce,
yes,
it's like still have to care about their behavior because my health is attached to his health through my son.
That's right. That's right. There is a sprawl. There's, this is why being able to, being a decent chess player in life, or at least having the ability to look past 3 issues to what might be on the horizon, is part of being an effective administrator or a leader or a CEO or a management professional or anything. So when you put someone in charge of something, they have to be able to not just go, "This is going to be awesome, bro," to everything that looks good and ignore all the bad, which is what Trump has been doing for weeks. Because of all the cascading effects of this. Again, a lot of people who go to the hospital for this, who are going to need medical intervention to save their lives. They're going to need intubation, they're going to need a chest tube, and they're going to need a tracheotomy in short order over the course of 48 to 72 hours. Those people, it's bad enough that there won't be enough beds for them anyways. But if you fill all the beds with those people, and they need them for a long period of time, if there's a bus crash, God forbid, or a chemical waste explosion, or any kind of there's an earthquake or a tornado. We're about to head into, light tornado season coming up again, when the weather changes, the temperature changes again. We get those kind of things in parts of the country around this time of year sometimes. If that happens, we're lucky it doesn't look like it will. But if it does, where do those people go? I mean, they would already be a rush on a hospital in that circumstance. So, I mean, just the amount of thinking ahead that's required just to be a grown-up, and I appreciate you doing it, but I'm sure you're just seeing how that's just not how people are operating half the time.
No, and just as another aside, he happens to be a Trumpy, which is one of the many reasons why I started to
Right.
him.
Well, it's also why he's on a delay of taking this seriously. Literally, Trump has endangered his own supporters by not taking it seriously earlier.
It's unbelievable that I can't even get him to watch read real journalism. Like, I've long since given up on that, but it actually affects other people in these situations. It's unbelievable. So yeah, he watches Fox News, so they don't get it. So, but get this, he also is a handgun type of guy, and he goes to a range outside of Aurora or something. I guess there's ranges out there where these guys go, these executive type of guys go and shoot at whatever targets. It's just gross. And he told me that on his way home from work last night, he stopped by there, and it was like crazy town. There was a run on buying, because they also sell guns there.
Yeah.
And this sent a chill up my, spine, and the hair on my arms was just standing up. He said that it was unbelievable. Guys buying guns, buying ammo, as if the apocalypse was coming. First of all, I said, why are they doing that?
I'll tell you why they're doing it, because, and this is especially in places, I don't know how rural the area around you is, but
well, it's in Illinois. That's just suburban Illinois. That's
right.
suburban.
Yeah. If you're on the edge of a big city, a lot of times this idea that everybody's bought out the toilet paper, that there's a run on things, starts to get people in a panic mode, because if this gets worse, if there's a sprawling, cascading effect to this, then they have this kind of Walking Dead, everybody's going to need to be armed to the teeth, because it's not about me getting enough supplies for a couple of months if we're all stuck inside. It's, what if I run out, or what if somebody else runs out who's armed and decides to walk down the block and get my stuff? And that's the fear. That's also the opinion they have of their fellow man, and the opinion they have of their friends and their neighbors, because they believe everybody thinks like they do. In certain areas,
something out of a movie. It's very scary. Something out of a movie.
But this happens, by the way, this happened after 9/11. This happened after the 2008 crash. This happened midway through the AIDS crisis, that gun stuff. When they started talking about 50 million dead from AIDS by 1992, there started being all these stories about how, maybe the United States doesn't get hit really bad by this, but the riots and wars in other countries where resource scarcity is a very big thing will drive violence into other countries, and you'll see people coming across the border trying to get away from hot spots and the like, and it will roll into, you're going to have to defend your homestead. All that talk starts ratcheting up whenever this kind of stuff happens, even when in the case of the AIDS crisis, was a 10 to 12 to 15 year arc of disease rise and fall as far as people's experience of it. The news of it alone was enough to get people to do that. So it's not surprising at all, and it's one of those things where they also believe that this is. I'm sure he lives in that fantasy zone of, the government's going to use this as a reason to put us all in camps. That crowd, because
He did say to me, he said, "Well, I don't know if it's so much the coronavirus as the Democrats are going to, they've said they're going to come for our guns. And if they get elected, and if Biden gets elected, he's going to confiscate all our guns." Right. They do believe that. And they don't get the differential of, no, it's the weapons of war.
Right.
They're idiots. They don't get that.
If you can't hit what you're shooting at in less than 10 shots anywhere, you don't belong, you shouldn't be allowed to have a gun around other humans. In a suburb, in an apartment building, in a city. I mean, if you live out in the woods in a, like Ted Kaczynski kind of a cabin or whatever, and you think you need an AR-15, there's an argument to be made there that pretty much you're just expecting the ATF to come for you because you've been making bombs and mailing them to people. That's why you want an AR-15. But anybody else, and the other thing is, in every bill that's been put forward about the limitations on magazines and all those kind of things, there are so many workarounds presented if you have a big farm and you have a wild hog problem and you need a lot of shots because boars just keep coming. Like all those kind of fantasy things that they present. There are workarounds where you can go, okay, yeah, you can have those, but you need a special license for it, and we need to know why. It's pretty reasonable, but we don't need. We'll get into open carry and how all that does is allow psychopaths to walk right up to the schoolhouse door before anybody can ask them a single question. Like, this is my Second Amendment right to walk around with whatever the hell I want. Or whatever. Well, then, what do you expect will happen when a nutcase wants to bring one of those guns to a mall? You think you're going to be the hero that takes them out? Well, you'll only do it after 35, 45 seconds, after they've killed 20 people. That's not self-defense. And if you can't hit them in 6 rounds or less, you're shooting in public in a mall. Okay. That's another topic for another time. Are you at least... Sorry, go ahead.
No number of mass shootings changes these people. So now a pandemic is just going to, it's just amazing to me. But I wanted to ask you, I'm seeing conflicting things on the news about how much the virus is carried through the air, because I actually read something on PBS that a new study had just come out from the NIH that it is airborne, actually. Yes. It does stay in the air for a few, which really alters
it is
a
air.
lot.
Yes. First of all, it's best to operate as if. That's what the social distancing is about. The biggest piece of information that I found about it came out of China, where a guy caught it on a bus from another guy on a bus. They were 15 feet away from each other, never touched the same surfaces, and neither of them were coughing. This was just breath. And they know, because they have CCTV cameras everywhere, that this is the only place that the guy who caught it could have gotten it from. They were tracking individuals who had it. They figured out that's where he got it, and they narrowcast it to that point. In the cruise ship situation, it's one of the reasons why they figured out over about a week, they're like, okay, everybody off. We can't just let them sit there. There's no way to isolate. If it was just touch, if it was just personal contact, we can leave them on the boat and it's fine. But the recirculated air was starting to get people sick, so they started moving people off and separating them. That was the crucial turning point. Yes, it passed.
No, I don't think people fully understand that.
No, they don't.
People think they have hand sanitizer, then they can just go to the grocery store and be around people. They stay 6 feet away or something. It's not like that.
Right.
You really do have to self-isolate.
And it's and you need a much bigger space. People are reminding me we're running along in the thing, but that is absolutely a factor. Here's the thing: if your health and well-being your immune system is fairly strong or whatever, your experience with it at that distance may be fine. You may process it and not get the virus, and it may not carry through your system. That's clear from just the volume of people who are further than 6 feet away that have been in exposure range. This one guy who caught it may have had underlying issues and a depleted immune system on top of that. The thing is, have an abundance of caution about your own health and safety in that regard. But going to the grocery and going to the pharmacy and those kind of things, you're going to want to take as much precautions as possible. Any mucous membrane, it can get into you. That means your eyes. So even if you're wearing a mask, you're not stopping it from getting into your eyeballs. So if you're around somebody who's close talking or those kind of things. So that's why the social distancing is necessary. The mask is really to keep you from coughing more germs and expelling them into the air, and that your breath won't carry forward. So if you have symptoms, you think about around anybody, that's when you wear something that covers your face. A scarf won't keep you from getting it, but it will slow the breath coming out of your face towards other people. So even though a mask won't stop it from entering your system, if it's not surgical masks don't work that way. As a matter of fact, surgical masks in surgery aren't even statistically helpful. That's a whole other story for another time. It's just a habit they do. largely having to do with smell and other issues, and touching their face. But if you are going out and you think you have symptoms or whatever, and you can't get a mask, wearing a scarf or something around your face slows the expression of the wet particles in your breath so that you don't spread it as much. So if you think you might be contagious and you have to go and you're alone and you have to go take care of yourself while you're sick, and you may be healthy enough to work your way through it, as 80% of people are, treat everywhere you go like a murder scene and clean up after yourself. Don't leave any fingerprints is the idea. We have to take a break. I appreciate the call. I went way over. We're going to have a short section on the next one. It's crazy. But I appreciate you calling in. We'll be back right after this. It's the Hal Sparks Radio program, Mega Worldwide. Infotainmentwars.com is our website, which brings you to here, halsparks.com. Follow me on Twitter at Hal Sparks, and you can HSRPM hashtag me there. We'll be back right after this. Yeah, absolutely right, Act. The surgical masks are more to prevent the doctor from spitting into the patient's open wound. That's right. It is not protecting the doctor from the patient stuff. Everybody seems to think that, well, I'm working with a sick and diseased person. That's why they have giant gloves going up to their elbows, and why they wash so much, and why, if they're doing that, they're wearing goggles, because it's about stuff getting into them. But most of the time they're not wearing goggles in surgery because it's about not getting their particles into the wound, not the other way around. Yeah. I always treat everything as a murder scene. No reason, I just do. That's right. This early in any new biological infection, they never know enough. Assume all means of transmission are possible for now. It's a great point. Can't stop lying. I mean, that's how you live respectfully with your fellow human beings. As Can't Stop Lying always does. So this is crucial. Men should be normal, but shave your face and trim your damn head. Yes. Might be a good time to be clean shaven, guys, because you can carry particles in your beard. One of the reasons why clean shaven was associated with first world country behavior and health and all that, or trimmed
1160 Hal.
Thank you. Articulated facial hair that was very well kempt was the idea that you don't have a lot of gunk, soup in your beard, as it were. Wearing a Halloween mask, so you're saying that's not enough? Depends on what character. It's got, one of those mouth holes that makes you salivate into it. Remember how sweaty and gross the inside of a Halloween, those plastic Halloween masks? All right, yeah, hipster lifestyle is over. New study, COVID-19 can last on surfaces for 3 days, as much as 3 days. Temperature has an effect on that. At certain temperatures it lasts longer, certain other temperatures it lasts shorter time. That's true of any germ. Best to operate as if. I just shaved during the last segment. That's wise. Very wise.
I'm Dick Kay from Back on the Beat, and here is the Mega Worldwide Radio program with Hal Sparks.
So one of the things we were talking about in the chat room during the break was the fact that being clean-shaven might be a good idea right now. And the other thing is, and I mentioned this as we were talking before, treat everywhere you go like you just committed a murder or you're a spy. You want to leave no trace behind. You don't want to pick up anything from there, and you don't want to leave a trace. So if you have hand wipes or any of those kind of things that you have with you, then like cleaning up the surfaces after you go. There was a wonderful video of a woman walking down a banister, and all you could see was her hand just running down the whole banister in the park where she was going down a stair. And you watch the video and you're like, oh God, she's touching all these germs. This is not good. Please stop touching the thing. And then you see at the end, she goes back and she's had a Lysol hand wipe in her hand the whole time, and she goes back and rubs the rest of it, cleans the base of it. She's been cleaning the banister the whole time, and she throws it in the garbage. this is a good general operating method right now. Let's grab another caller, and we'll try and get them in this chunk before we have to take the last break of the show. Who do we have, Devin?
Next, we have Tom out in Chicago.
Cool.
Oh, you're good.
Okay. Hey, Tom.
No, I need to let him know now when in the background. Tom, it's like you guys are chatting like, what's that?
Hold on. I can hear. Wait 1 second. I can hear you, Devin, in the background, so I can't hear Tom. So, Tom, go ahead. Say again.
Okay. I was saying thanks for everything, and here's the preponderance of agreed information about the formula for making the hand sanitizer at home. It should be 91% rubbing alcohol, 91%. And the formula is 2/3 of a cup of the 91% alcohol and 1/3 of a cup of aloe vera gel.
Gotcha. Other way around. Reverse mixture than what I was saying. Thank you for clearing that up. So 2/3 alcohol, 1/3 aloe vera gel.
Yeah, 91% needs to be up there.
Right. I appreciate that. Are you at this point making your own, or do you have plenty at home?
I have started making for when the other stuff runs out, because people have been like grossly hoarding and screaming about, non-cooperating. When a manager said, ma'am, would you mind leaving some? I mean, she filled up her damn shopping cart. And when the manager said, would you mind leaving a few on the shelf for other people? The woman screamed at her, I don't care about other people. I mean,
Right.
It's like that. And a week ago.
Yeah, right.
My was that she probably owned a little store, and she was going to jack them up to $10-20 a jar, a bottle.
Well, yeah. Well, that's hoarding and price gouging in these kind of situations. It was rampant in China. They had to step on it with both feet, but still, it was going on. And expect some form of that. You can also, if simply you do not have any, and they can't, like somebody was saying, aloe vera gel and the shelf is bare or whatever. There are other, gels you can put it in that are relatively inert. There's, and you might find like the aloe vera gel stuff in the food aisles that would go with it. There's, it's really just about getting it on your hands, is getting the alcohol in. You may be able to just get one of those pump spray bottles of alcohol and just use that. Bring it with you and spray your hands that way. It's not optimal, but it is very effective.
It can happen.
Yes, exactly. So I appreciate you calling in and telling us that. We'll talk to you next time. Stay safe. We'll everybody who's called in today is assigned to check in with me over the next couple of weeks, so I know you guys are good. I think we have another caller too. We might be able to fit them in.
No.
Do we, Devin? Nope, we're good?
Yeah.
Cool. All right, excellent. So there's a continuing, I guess are they still doing their update here? No, it's done. Okay, so the news conference is over with the, thank you, Connie, for the super chat. I appreciate that. Awesome. For the 24/7 chat room to keep us sane, right? Yeah, we will. I'll be back on after this show. We'll do the post show like normal that we regularly do on the show, but we'll continue for about an hour after the show, and then I'll be back later on. I'm trying to arrange a couple of guests to come on, like Jackie Schechtner and others, just based on availability, so they can kind of we can have a deeper and broader conversation with this on my YouTube channel. So if you want to come back when that is, just there's a bell notification thing. You can click the bell, and then it will let you know when I'm on. But I also send out a social media notification right before we go on the air, so you know it's happening. So this is a crucial time for everybody to practice good citizenship overall, because we're seeing a bunch of people, and this may be exaggerated by the news and just to aggravate people into behaving a little bit better, or it may be a reality on the ground. A bunch of people saying, well, kind of having this YOLO idea that you don't, you only live once, so whatever, doesn't matter. I really honestly, if as an individual you are that careless with your own life, I can't do anything about that. None of us can. You know what I mean? That you're going to have, thank you, Thomas. You're going to have other issues beyond this that may take you out anyways with that kind of an attitude. My issue is other human beings. You are endangering other people, and you are putting lives at risk of people that you do not or may never know. And that is going to become a crucial part of this. And so if you're going to behave in such a way, wear a shirt that says super spreader on it, because that's effectively what you're going to be doing. This is too crucial a moment to not take that into effect. And I don't care if you don't like your parents, but a lot of us do, and we would like them to be around for another decade or so. And if you can't be bothered, then effectively your depraved indifference is a form of murder, and it's disgusting. And if you don't find that a moral failing on your part, I do not understand how you live with yourself regularly. Can anyone be perfect in this circumstance? Absolutely not. There are too many issues that affect us in our lives that will make this a perfect situation. You have a responsibility, though, to do everything within your ability to minimize that effect. I, for example, you guys know I've been working out a bunch lately. I go to the gym. I have a few weights here. I'm going to be modifying my workout system, but I'm going to be going to the gym that we have. I belong to a gym, but they're 24 hours. I'm going to be going at super off hours, and I'm going to be going in there like I can't afford to leave a fingerprint anywhere, wiping down the machines before I use them and after, for the safety of everyone involved. And the place I check in with uses a key fob, so the person behind the counter doesn't have to go anywhere near me. And that's one of the reasons why I feel okay about using the facilities there for the time being. If that changes, they may end up shutting down. But if it gets packed with people who are like, I need to be healthy, and so I'm going to keep working out, and if I go in there and there's too many people where I can't have that distance away from them, I'm not gonna do it. And I'm also not gonna be working out as hard to get myself huffing and puffing. Sweat does not contain the virus, but since breath does, if you're overexerting, if you're jogging and breathing really hard, that's another factor. So these are things we focus on. That we're going to take a break. We'll be back. It's the Hal Sparks Radio Program, Mega Worldwide. We'll be back right.
This is Jim Allen, president of the Bricklayers and Allied Craft Workers, and this is my story.
I hear the feed.
Cool.
Thanks.
Sorry about that.
No problem. Was everyone talking about whether or not Bacardi 151 will work as hand sanitizer? Sir, have you been drinking? No, I'm trying to avoid the coronavirus. Thank you, Venus Flytrap. Appreciate that. Hi, everybody on Twitch. I will be gaming later, too, because I think we all need a break. So we'll figure that out over the course of the day as we self-sequester and we're all trapped inside here. And thank you so much to the patrons who are hanging on. You guys are crucial. We still have that goal of 500. If this delays that goal, I'm 100% fine with that. We will pick up right where we left off. I am using this time to woodshed and try to make the show better. I've been building graphics and doing that kind of stuff that I'll be able to launch in due time. But like I said, you guys take care of yourselves first. But if you can help the show, we love you for it. Greatly appreciated. Libraries closing, what will homeless people do? Well, the homeless issue is another cascading aspect of this, that on a lot of fronts, the people who advocate for the homeless in cities like Los Angeles, in some ways...
Come back in 60 help.
Thank you. Can cause more harm than good by defending the encampments and not allowing governments to clean the area and those kind of things, or allowing, pushing for structured home instead of saying, people shouldn't, if they're living on the street, should just be allowed to stay there. And that's a reflection of their rights, not the other way around, are avoiding a fix to the problem, and it's quite dangerous. So the growth of encampments and the normalization of it in Los Angeles has as much to do with government inaction and homeless advocacy groups working, like against each other to create this perfect storm of disease. We've already got, typhus and plague and all kinds of other stuff.
Welcome back to the Hal Sparks radio program, Mega Worldwide. It's now time for the happy ending. Yay!
Yeah, we hope. We don't know. Here's the happy ending. A lot of people, in spite of the fact that the government is completely useless currently, a lot of the people are taking it upon themselves to treat this quite seriously and act as if this matters to them. And for those of you that are self-quarantining, that are taking this seriously, I applaud you. This is, you are doing what it requires, what this circumstance requires. There's going to, Dr. Fauci has said repeatedly, this is going to get worse before it gets better. He is not even remotely. Oh, thank you for the sticker, Joe Carter. I appreciate that. That's awesome. This is the great beard out. Can't stop lying. Yeah, we're all gonna stay. Even though my hair is growing long, but it's away from my face, so I think that's okay. I might eventually grow enough to put it in a ponytail. We're all gonna be living like George Washington, wearing wigs. This will get worse over the next 2 weeks. The cascading effect of what happened a week ago and what it's going to cause in a week is unavoidable at this point. This is, you have to understand. Thank you, Joe Carter. You have to understand that the damage that is done next week, the damage that shows up Wednesday, Thursday, Friday of next week, and it will start to get extraordinary. And I'm just telling you this just to be emotionally prepared, and economically and prepared in terms of supplies and the like. Thank you so much for joining Patreon. I appreciate that. Again, don't join if it's outside your realm of capability at all. Please hear me on this. That said, the damage that will occur next week are from infections from early this week that were caused by a lack of action the week before. Understand that what's happening next week is not an emergence. This is a national emergency, but it is not emerging as it happens next week. It is a cascading effect from behaviors 2 weeks before. We are all. Thank you, Tom Lunzer. I will. We will definitely keep healthy as best we can in this process. And if we take steps right now over the next week, we will slow the cascade 2 weeks from now. Nothing will stop what's going to happen in the next 2 weeks as far as damage from the disease. The deaths that are coming are baked in currently. Understand that. But we can keep it from expanding past that point. The actions you take today save lives 2 weeks from now, and it's hard for people to process. But that's the behavior that's necessary to stop because some people will get frustrated that they'll be, okay, we were all self-isolating this week, and then deaths happen next week. They're going to say, well, it's not working, and it's already out, and and then they'll start, getting fatalistic and not taking care. You have to know that there's a rolling cascade to this, and your behavior this week and next will affect the arc of it. So keep that in your mind. Cap the Goat, thank you so much. Keep that in mind, guys, over the next couple of weeks. And as we, there are so many people that can be affected by this that are in the danger zone that are not elderly. One of the effects of this, and you guys got to hear me on this, is because we've been talking so much about the body positivity movement and the languaging around that movement has, I think, met its worst enemy in the coronavirus circumstance. Because people who have lung issues and regular disease, have former smokers and the like, are an obvious aspect because they are more prone to get pneumonia. This disease, how it ends up killing people, is that it infects your lungs. The damage it does to your lungs allows pneumonia bacteria to grow in there. It grows so fast because of the damage that's been done to your lungs that you effectively drown in your own fluid in your lungs. And it does it very quickly for people who already have pre-existing damage to their lungs. That's an obvious warning sign for some people. So previous smokers, people who have had chronic bronchitis, all these things are obviously a part of this. But it also affects people who are diabetic or who have immunodeficiencies aligned with other things. The immunodeficiency aspect, and hear me on this, think of every pharmaceutical ad that you see that says, taking this drug may impact your ability to fight off infection. Think of all the ads you've seen over the last 2 years and the number of people who are on those drugs right now. Those people are also at very high risk because while under normal circumstances they might get they might be able to fight off this part of the disease, the fact that it increases the chances of them getting pneumonia, which they won't be able to fight off well because of the medications they are on or have been on, is incredibly dangerous. You guys, can you hear me on this? All those medications that diminish your immunoresponse, that have there are so many pharmaceuticals that get advertised all the time that have this as a they don't even call them side effects anymore. They call them contraindications. As a contraindication, immunosuppression is a huge part of this. And there are so many people in our country specifically, the vast majority of the people who are dying in Italy are very old because the rest of the country doesn't have these underlying issues and are not so, pharmaceutically attached in their wellness as we are. Same thing is true of South Korea. So because we are reliant on a lot of these prescriptions for chronic disease in this country, related largely to lifestyle issues. And again, if this isn't a lifestyle, if you have a hormonal deficiency and that's why you're overweight and that's why you ended up with diabetes, I completely understand. You need to be just as careful as they do. I'm just saying those folks are all in the same boat. And so if you have a friend with diabetes, one of the things that diabetes, you have trouble fighting off infections. That will become a part of this. I'm just saying, I take that extra care because while you're not thinking like, okay, I'm not going to see my grandmother, I'm not going to see my parents, I'm not going to visit with them because I know they live with a parent. So, I'm taking care of that part of it. But it's become so normal that your friend has an ongoing chronic illness. Call them up and ask them if they're on any medications that depress their immune system before you go visit them, even though you don't think they're in the zone. It's a good question to ask of your close friends. And it might be, you don't have to know what the problem is, but are they taking medications that will do that? Know that before you go visit with them or you bring them supplies or any of those things. It's just a factor. I love you guys. I appreciate you guys. Please stay safe during this. Like I said, I will be on streaming practically every day, if not every day, for the foreseeable future. Thanks for sticking around for the post show. Stay tuned for Dick K. He'll give you the local updates. Dick, you might need to shave your beard, buddy. We're all excited to see your chin. I hope you stay healthy. Devin, you stay healthy too. Make sure everybody there is taking care of themselves and those around them. And we'll see you guys next time. Take care. So,
All
hi,
right,
Chap.
I'll see you next week.
Yeah, thank you, brother, so much. Take care. Be safe.
You too. Have a good night.
Okay.
Or
All right.
day.
Cheers. Yes, or whatever part of it doesn't really matter. It's all nighttime now. Okay, bye. Oh my God. So this is ridiculous. So let me see if I can bring this up. I don't know why this does not want to load on. This computer does not want to load. Is that off? Oh, thank you so much, Michael Anderson. I appreciate that. Yeah, thank you guys for the super chats today. It really helps because we've canceled all my shows insofar as I know. Like I haven't talked to Caleb, but I'm pretty sure the Nerd Halen show on Monday is gone. And while, I mean, the rest of the guys in the band are counting on that for gas money in life. So yeah, like for whatever reason. Twitter is not loading on. That's very curious. Okay, let's see if I can figure out why. Yeah, here we go. I can at least bring that part of it up. Criminy. So. What the hell? The United States loves Italy. What is he playing? Good Lord. Hold on. We'll switch to the post-show graphics real quick. Here in just 1 second. And I'm not going to have time to set up this scene, so forgive me if there's some noise in this. But I will also close these things. I don't want to get confusing pages up and open. There we go. And we'll go to this guy. Yeah. This is what Trump just tweeted. All caps. The United States loves Italy. Look how good we are for Italian people. Unless that has, like, disinfectant in it, I don't know what the hell that is. This is, and the number, okay. So then COVID's coming in here. This is, okay. Here you go. Here's, wait a.
Sometimes you have to stop and think about what's unique about the United States. And one of the things that is really wonderful, and we should stop and think about more often, is that we have so many people who are willing to put aside their self-interest for the good of the nation. And I want to...
Oh, my God. Coughs right into his hand, then touches his nose. Christ. Like, this, oh, easy. People are running history of pandemics on here. That's fun. How you catch stuff. Oh, this is him.
I've been urgent. This is urgent for me right from the...
Has your own sense of urgency evolved, and are you changing what you're doing?
No, I've been urgent. This is urgent for me right from the beginning.
Have you been briefed by the CDC? Are the words about a pandemic at this point?
No, we're not at all, and we have it totally under control. It's one person coming in from China, and we have it under control. It's going to be just fine.
How concerned are you?
Well, we pretty much shut it down. Just take it nice and easy, okay? Just relax.
Like, just...
Has your own sense of urgency evolved, and are you...
It's ridiculous. Like, and by the way, this is how it goes with no social distancing. That's how it goes with social distancing. That's with extreme stuff. The social distancing, which we have been doing, this matches almost exactly where our chart is actually going in this case. Like, this is, and the number of people, like, just, oh, these are the Italians singing, You guys have seen this, I'm sure. They're just like playing along with music. I think Trump saw this. Yeah, this is. Everybody's out there. Everybody has a tambourine in their house. Amazing. Like the absurdity of this, like the just Trump's response in general. I mean, I went through this yesterday. We looked at his lead up to his speech and then his like coming out and saying got this under control. Everything's fine. This is not a big deal. And it's just hush. It's going to be no, like, here's, again, I'm going to tweet about this in a little bit after we finish the post show. But yeah, Sam Blam Blam, that's a curious aspect of this is I've never wanted to go to Italy more in my life than now. Like I have loved the idea of there's certain European countries I haven't gone to that I want to go to, but in all honesty, Italy shot to the top of the list just because of what they're going through as soon as this is possible, and as soon as I wouldn't be bringing anything with me, This is. Yeah, this is the whole. Yeah. Scrolling through right now, catching up on the on the video that's coming out of this, but in general, Trump has been downplaying this from the very beginning. The stuff he said about the numbers that he didn't want the ship coming because it would double his numbers is just indicative of how he views this entire thing. This is all about him and economic numbers around it. Let's see. Scientists say Venice maybe has 3 decades left. Oh, as far as the water rising, yes. How you can bring your bagpipes. This is true. I'm going to roll back and get some of the chat stuff that was in here. The one case of COVID in North Dakota is in my little town. Wow. Well, if it's a small town, and if everyone can practice social distancing for a long enough time, and everybody cleans surfaces around them, you are in better condition for a lack of spread than people in middle-size or large towns. Oh, thank you, Tom. You're right. I do not need. Well, do I need the earbuds to hear the? I'll see if I need them for to hear the audio from the videos that I play. Usually, that's the case. We'll find one and see. But COVID-19 graduation pictures. Oh my God, people are FaceTiming graduations. I mean, there's. So let me see. Gas might be cheaper, but I want electric cars to be cheaper too. That whole like the Russian Saudi thing about oil prices is just a way to push themselves into a situation where gas is cheaper and people will put off getting an electric car for another year or two, which allows them to squeeze as much profit out of it as possible before it becomes useless.
Gas explosion. The Russian bioweapons lab containing smallpox, Ebola.
So that's what I got to shift to. So 1 second, so that I can hear what you guys are hearing. Let's see. Turn that off. Go to audio 2. There we go. Turn this on so I can hear it. Let's see if I can hear it now.
And HIV virus sparking major emergency.
That is absolutely wonderful because as an environmentalist, I say to myself, the best possible news
would be some mega emergency which got rid of huge chunks of the human race.
That's Boris Johnson's dad. Yeah. The amazing thing about this is one of the reasons why a slow rolled effect might be happening in some areas is because the people who first get it are, part of the expendable population as far as the passive eugenics crowd are concerned. And it's hideous. But that you can tell they're like, well, it's only, not really hitting like the working sector. So do we really need to act that quick? I mean, that's 100% where it seems like Trump was leaning, even though he's in the age range most affected by it. Yeah. I mean, God, it's ridiculous. But here we go. Let's see. Hi, Al, thanks for talking to me today. I'm a single mom. This has me freaked out. So isolating. It's wise, Catherine. Just, I mean, we'll all have big hug fests after this arc shifts, and we know, we have a situation where everybody can get tested who needs to be tested, and all the steps are being taken. It's incredibly important. Can I remind you guys of some of the stuff that this is? Let's see. When super spreader was able to infect 40 people. That's from February 22nd. The area of, what I want to say, 200 people infected. There are, on this ship, 218. That's from the week before that. This is from February 1st. And the coronavirus as well, by the way. The death toll has doubled in the last 24 hours. I think it's 256 now. Like, have I not been... That's February 1st. That just on this show, we've been talking about this stuff in the background. I am behind on the chat. I had to roll back and say stuff. Did I miss something? That happens sometimes. Sorry. Do I think Trump has it? We can't hear you. You can't hear me? You sure? Hal is sitting on his microphone. Did it fall off? No, it's all right. Check. It seems to be going through. That might be a internet thing. I'm not sitting on it. Oh, volume is too low. All right, we'll fix that. 1 second. Oh, it might have been doubling through another source. I got it. Let me fix that. Hold on. There we go. Was that better? Can you guys hear me now? Better? Sorry. Does that work? Is that better? Let me see if this is coming through. Well, is that better audio-wise? Yes, it's fixed. Okay, good. Yeah, so I shut off part of the Chicago feed so I could play audio through for you guys, and it just dipped the volume. So, okay, I can fix that right now. But yeah, that should effectively... Yeah, let me make sure that... Just me... Yeah, so it was doubling on the other channel, so that's why it was super loud. Yeah. I mean, I can't... I'm not surprised at how the Trump administration has been handling this. There is nothing in their behavior that points to them actually handling anything as adults. Even fears of recession. I mean, look at the frigging... recession fears that were going on beforehand. Oh, this is Trump's COVID.
Thank you very much. We just completed a very good meeting of the coronavirus task force, and they're really doing a great job, our professionals. The results are very, very good. And when you compare this to what's happening around the world, we're very proud of our people. And there's been a tremendous amount of coordination with states, with cities, and they're...
No, there hasn't, and you're not proud of it. And somebody got mad at him about the campaign hat. So since he didn't have time to do his weird hairdo, and it takes 2 hours, and he looks really good right now. Doesn't he look really healthy? I mean, honestly, fabulous. He came out in a USA hat, just in case you know what you're supposed to chant.
A little smaller form of government, and they have things going well. They're coordinating with us, and
Yeah, for those of you that didn't know that,
certain in particular, I think
that mayorships and governorships are smaller than the federal government. In case you were unaware,
California's been terrific. The relationship, New York has been really good. We've had some really good relationships in terms of, especially the
yeah, because those states don't want their citizens to die. Why would they pick a fight now? What a
hotspots, and we're focused on those hotspots. Some areas we don't have no problem whatsoever, and we hope to
we don't have no problem, so it's a double negative. So we do have a problem. Holy
keep it that way. Before I turn this over to our great Vice President to provide an update, I just want to express my appreciation for the hard work done by the people behind me and the people
I've been coughing on.
The various offices, including the fact that I just left the Oval Office, so we have some people.
We have some people in there that are, symptomatic, and I just made sure that I touched everything in the Oval Office.
There that are probably watching this, or they're
what?
Just working.
All right, we're in hell. We're in hell. We're in hell. This man is a moron. He just left the Oval Office, and he thinks they might be watching him on television, or maybe they're just working.
We're using the full power of the federal government to defeat the virus, and that's what we've been doing. Last week, we secured an initial $8.3 billion from Congress for the...
They gave it to you. You only asked for 2.6.
Coronavirus, and that was quickly done and very efficiently done. I want to thank all members of Congress. Yesterday, I declared a national emergency, which was a very big deal because it opened up avenues that we would never be able to open up without it.
Yeah, we know. That's what emergencies are for. That's why states do it. And when states do it, you and Ted Cruz and half the Republicans go, well, is it really an emergency, honestly? I mean, should the federal government help them? I mean, it's only 100 people who are drowning currently.
And it will make it more it'll make more than $50 billion available to us immediately in disaster relief funds. And that's available for states, territories, and local governments. So that was really, really good.
You're welcome. You're welcome for me doing my job a little bit at a time.
We also reached an agreement yesterday on a new legislative package that will provide strong support for American families and communities in dealing with the coronavirus. So it was...
Yeah, and the Senate's not going to vote on it till Monday because Mitch McConnell knows that, one of Putin's checklists is a bunch of dead Americans. Why would you, if you have a cascading pandemic that's going on right now, every hour matters. Again, the stuff that doesn't happen this weekend will cause the stuff that does happen 2 weeks from now to be worse.
It was done very, very bipartisan. It was very nice to see it. Probably the cooperation. I want to thank Secretary of Treasury, Steve.
I honest to God, dude, if there's ever a day to do a rail of Adderall before you come out and drink 15 Diet Cokes so you're peppy as hell, this is the day to do it. You cannot come out here during your 7th frigging coronavirus briefing as you keep painting over every mistake you make and sound like you have it.
Steve Mnuchin, who did a fantastic job and worked with Nancy Pelosi and their representatives, and it was really great. It worked out very well, and a lot of people are benefiting by it. A lot of provisions in the bill, which they're going to be discussing with you today, and they're tremendous provisions. So that's something that we should talk about.
You guys got provisions? Make sure you have lots of provisions in your bunker when you're hiding from the Armageddon that I caused because I sat there with my thumb up my ass for a week.
honored to see that the stock market, you were mostly there with us, set a record in a short period of time, over a 45-minute period, that we had the press conference yesterday. And
you timed out the flood of the money into this, for Christ's sake, so that it would go up while you were speaking, because of $1.5 trillion in short-term funding went into the stock market, and you knew what time it was hitting. What are you talking about? Like,
Rose Garden, that was a record, all-time record.
Yeah, along with the 8 all-time records of it crashing. It's still looking at the floor.
I think we should do one of them every day, perhaps.
Oh my God.
But how about 5 times a day? We'll do one 5 times a day.
Yeah, declare 5 emergencies a day and dump $1.5 trillion into banks and short-term loaning and finance companies 5 times a day. What the hell?
But that was something to watch, and I had no idea. We walked back. I said, "So how did that work out?" They said, "Sir, you just set a new record in the history of the stock market." So that was pretty good. And
Jesus
those
Christ!
Great company.
Yes, and in the chat room, there is no Google website. Edward Brayman is mentioning the market will tank because of the lying regarding the Google website development. Yeah, it didn't exist. Google's website, Google's stock probably got a slight bump from that lie, and then they're going to lose even more when it turns out it was a lie.
That were there, they couldn't have been too unhappy either when you think about it, because they're all very big publicly listed companies, so they did a good job. And more importantly, they're going to do a good job. When you look at CVS and Walmart and all of the tremendous people that were there yesterday, these are the big...
That I shook hands with, even though I'm obviously getting sicker by the day. I managed to shake hands with the heads of all these companies so that the managerial class of the entire organization will collapse, and no one will know what the left hand won't know what the right hand is doing, and you'll end up, instead of getting tested in a Walmart parking lot, we'll all just be camping there after the looting starts.
Biggest and the best, and they're opening up their facilities. They're right now, literally working right now on doing something that's never been done before, to the extent that we're doing it. And
yeah, because there's never been this much governmental malfeasance around a rolling epidemic before. The firemen are doing stuff they never thought they would do because I set fire to a bigger building than they were prepared for dealing with. We built a fire trap in the middle of a small town, a skyscraper in a town where all the other buildings are 3 stories high, and the fire department is doing things they never thought. They're setting records for the amount of water that they're using because we all smoked in bed in the giant building yesterday, which is made out of balsa wood and crepe paper.
So we're very proud of them. Also, the bill provides for free coronavirus testing for all Americans who should be tested. So people that are getting tested are getting this free. They don't have to pay. A lot of people said, "Gee, it's a lot of money," and it is. It's a pretty complex test, actually, and it costs money. And
oh, good Lord, man! Good Lord! Like, it's a test and it costs money, and money is more important than it. But we're gonna pay some money for the test, okay?
It's being provided free, so people don't have to worry about that. It also provides paid sick and...
Billy Hutchins says, did he just say the same thing twice? He says everything twice. It's part of his vocal tick.
Family medical leave for those who need it, including for those who have the virus, for caregivers, and those looking after children affected by school closures. So that's all taken care of also.
No, it isn't taken care of because the Senate hasn't voted on it yet. It won't get voted on till Monday. And that's if they let it pass without amendments messing with any of this stuff. If Rand Paul doesn't put an anonymous hold on it, which is totally possible.
And we'll continue all of these different actions. We have other things planned. We're going to also be working with companies that are affected financially. Our country is in the best financial shape. We've so different than the past over the years. If you look at some of the real big crises we had, It was financial problems and different things. We now are in very, very strong financial shape.
Yeah, because the Obama administration rebuilt the economy after the 2008 crash and saved the auto industry and a dozen other things that you were against. And the arc of the actual growth in the country has matched that growth the entire time. Like there's nothing extraordinary about the Trump years, and the losses he's just seen um, are have erased effectively most of the gains that anybody could say are higher than that arc. And by the way, there's going to be a rally in the stock market probably in the summer after the initial deaths and the horrifying aspect of it as the stocks hit bottom. There's going to be a rally because people are going to buy in because these companies didn't become less valuable because of this. They just had their customer base murdered by the inaction of this moron. And he's going to claim that the rally is his too. The losses aren't his.
With all of the trade and all of the other things that we've been doing,
we've been doing so good.
We hope the Federal Reserve will finally get on board and do what they should do, because we're doing things that they should be doing, frankly, and we can all do them together, but they should be much more proactive.
Yeah, I don't know if he's going to pass out or not. I don't think the four people behind him could catch him.
Boards.
Maybe the doctor, but the other three, I'm guessing, are going to just take a hard step back.
In other countries and people representing those countries are taking a much more aggressive action than our
everything
Fed,
is going fine.
So we'd like to see the, if you look at central banks yesterday, what they did, we want to see our Federal Reserve be much more proactive.
Jesus, he looks like he's holding himself up on the podium. He looks like, honestly.
It's important, but in the meantime, we're doing things that have been really well received. I guess you saw that yesterday at the end of the day with what we've done. We have a lot of things to tell you in terms of respirators, in terms of all of the different things. The masks are being made by the millions and millions. We have plenty now, but we're ordering for the millions. We're ordering worst case scenario. We always say worst case scenario.
Yeah, that's what we've always said. Worst case scenario. That's why I got rid of the pandemic team, because I was like, worst case scenario, I have to see them every day.
And that's where we're going. So I just want to thank everybody. I think the press has been really, over the last 24 hours, I think the representation's really been very fair for the most part, been very fair. We're all in this together. It's something that nobody expected. It came out of...
No. People have expected this for decades. You know it's coming. We live in a multinational country. We are crossroads of the world with like the amount of trade and the amount of different people and the diversity of our country. That's precisely why you know infectious disease will be a factor. Nobody thought anything would. That's why we fired those people. Because why do I have to see them if it's not going to happen?
China, and it's one of those things that happen. It's nobody's fault. We all will solve this problem. We'll solve it well. I think the American people have been incredible in the way they've acted. There's been, and if you look at companies...
Yeah, because we have to, dipshit.
And sports leagues and all of the things, what they've done is
incredible.
It's just something very special.
It's very special.
Being told, necessarily.
Incredible.
In some cases, perhaps they were told,
also
actually.
magnificent.
But for the most part, they want to get it over with. They want to get it over with quickly and with very little death. As of this moment, we have...
Well, that's it, here lies Donald Trump. He wanted to get it over with quickly and with very little death. But it's...
have 50 deaths, which is a lot of good decisions were made, or that number could be many times that, but that's based on a lot of good decisions. One or two in particular. You know that Europe was declared the hot spot yesterday, a big hot spot, and number one, and we made a decision quite a bit prior to that, but we saw what was happening. But if you have any questions, this group will be very happy to do it. But I just want to say they have been...
I gotta go lie down.
Mike Pence, they have been incredible.
They're
the job
great.
they do.
I've been
working
doing this
20
whole
hours a day.
speech with a rectal thermometer in, and it's really the only thing keeping me standing is the fear of sitting on it if I fall backwards.
This man is working 20 hours a day, or maybe more. Is it more? I think it's more. Tony has been working. I'm just looking at this whole group, and we've
Let
created
me
a number
breathe
of
at
new
them.
stars,
Let me touch everybody.
including the gentleman right behind me. I watched him the other day. It was such a fantastic job you did.
What's your name?
I really appreciate it.
I
But they're
can't
gonna
remember my own doctor's name. He couldn't remember who he was. He has no idea.
be answering questions, and we have a lot of new information, so I think you'll find it very interesting. And I'll be going back to the Oval Office. Thank you very much.
I'm going back to bed. Executive time. Diet Coke.
Mr. President, there are so many people right now that are rushing to Costco. They're rushing to grocery stores all over the country. They're filling up their baskets. Is that the right move? Do you think that people should actually be saying, maybe conserve as opposed to buy? Also, overnight, Apple, sir, they announced that they're going to be closing all of their stores for 2 weeks. Do you want to see other retail outlets, restaurants, stuff like that do the same thing?
I think it's fine if they do it. I think frankly, it's good if they do it. I think what Apple did is fine. And I want to keep people away for a little while. Just keep them away.
Well,
and when it gets better, well, people are going and buying things, and I understand that. By the way, I had my...
That's what they're doing. They're going and buying things. People are just buying things.
Yeah, Mr. President, why do you look like shit?
Temperature taken coming into the room. You did good.
Yes, sir. Yes.
Let's compare. Do you want to compare?
We did all of it. Yeah.
Good. Well, that means we're all looking good. I also took the test last night. Yeah. And I decided I should, based on the press conference yesterday. People were asking, did I take the test? I don't know, whatever it takes, a day or 2 days, whatever it is. They send it to a lab.
But I'm not self-isolating during the time.
Oh my God! Like this is exactly what they told him to, needed to be done. Is if you think you need the test, only take the test if you've been exposed to somebody, which he has. Multiple people are isolating themselves and quarantining themselves because they've had exposure to it and are getting sick, and they all met with him. They all were in the same room with him, shook hands, breathed right in his face, and vice versa. And after you take the test, they tell you, while you're waiting, wait at home, have as little interaction as possible.
So you've been sending mixed
Only
messages.
because the press is going crazy.
Mr. President, respectfully.
Only because the press made me do it. I wouldn't have gotten a test. But you guys, why won't you leave me alone?
You've been sending mixed messages. We watched as you shook hands with people yesterday. You have talked about...
I don't think I've been sending mixed messages. I've been on messaging. I don't know if that's a nasty question.
5 million tests being available, probably won't need that many. Has your own sense of urgency evolved, and are you changing what you're doing?
No, I've been urgent. This is urgent for me right from the beginning. You know that because I closed up our country to China.
But why are you shaking hands, sir?
This has been urgent from the very beginning. Like when I said there would be 15 cases and soon it would be 0. And it's not a big deal. And people can just go to work because then they have it. They don't do it. It
becomes a habit, and you get out of that habit. And frankly, I was a non-handshaker for the most part. I never believed that shaking hands once you become a politician. And I notice it too.
That's a dumb... Okay, what? Do we play the video of all the ridiculous handshakes this jackass has been doing over time? He grips the... He squeezes everybody's hand to death. Should we just show him and Macron together? Like when Macron punks him by not letting go? The jerky
Political
handshake?
people walk up to me. They want to shake my hand. I said, well,
He shook hands with all the heads of the companies yesterday.
Just take it nice and easy, okay? Just relax.
What kind of patronizing...
Come up to me. They shake hands. They put their hand out. It's sort of a natural reflex, and we're all getting out of it. All of us have that problem. Somebody comes up to you, they put their hand out, you probably tend to just shake it. And we're all getting out of that. Shaking hands is not a great thing to be doing right now, I agree. But people put their hand out. Sometimes I'll put the hand out. You don't think about it. People are thinking about it more and more. We have to think about it. It's important. Somebody said yesterday, I touched the microphone. I was touching it because we have different height people, and I'm trying to make it easy for them because they're going to have to touch because they wouldn't be able to reach the mic. They wouldn't be able to speak in the mic. So I'll move the mic down. And they said, oh, he touched the microphone. Well, if I don't touch it, they're going to have to touch it. Somebody's going to have to. So I might as well be the one to do it. But no, we all have to get away from, getting away from shaking hands is a good thing. And possibly that's something that comes out of this. Maybe people shouldn't be shaking hands for the long term because
Yeah, we need to eliminate handshakes because of this. Because the Spanish flu and the plague didn't manage to get rid of handshakes, but this will do it because
Maybe that's the good news. Maybe that's the Trump legacy. People not shaking hands anymore. It's stupid. By the way, if they didn't move the mic, I had to move the mic. They touched it too, for Christ's sake. Thank you, say what? Shiba dog shaking his hip saying thank you. Oh, is that a real dog or is that a code? I don't know. But either way, thank you, Shiba dog. Pets, pets, pets.
It does transmit flu and other things. You know, we have
People
flu
are
in our
disgusting.
country that kills on average 36,000 people a year. 36,000 people. And, you know, that's something that we're not talking about. But as of this
And
moment,
I
we've
blame the
lost
handshake. That's what I blame. You know, if we weren't shaking hands all these years, why didn't they ask Trump how to cure the flu earlier? Because I would have said, stop shaking hands. Let's shake on it.
50, possibly a little bit less than 50, but probably 50 people. And we're going to try and keep that number as low as possible.
The Pentagon is telling service members and their families not to travel domestically. Should all Americans follow that same advice?
Well, if you don't have to travel, I wouldn't do it. If you don't have to travel, we want this thing to end. We don't want a lot of people getting infected. We want it to end and end as quickly as possible. So far, I think we've done a fantastic job.
Who gives a goddamn what you think of your own job? You know what I mean? Like, why does he think anybody cares how he feels about how they're doing? Like, and he says it repeatedly like a tick.
Like, I think we're doing a fantastic job. I think they're doing a fantastic. This is fantastic. All of it's fantastic.
Who cares? Who needs that as a reassurance? The details are either reassuring or they are not. And here's the thing. Don't say you think you're doing a great job. Go, we're doing what's necessary in this, this, and this. Don't give yourself a grade in it. Oh, God.
I think that the people behind me have not been given the credit that they deserve because they have done.
What?
These people should be winning awards for just breathing near me.
Done a fantastic job. When you see all these school closures, when you see the school closures are very important, but it causes a lot of problems. The bill that we signed yesterday takes care of a lot of those problems with children staying at home and the parents are working.
He didn't sign anything yesterday. The bill that went through hasn't been voted on yet. It won't be voted on until Monday.
Now we take care of that issue with what we passed last night. Now it has to go through the Senate. I have to sign it, but that will happen. But I'm now going back to the White House. You have great...
Yeah, he basically says he signed something that hasn't passed yet.
Professionals, and if there's anything that comes up, if there's anything...
Do this.
Questions. Stupid. See, I told you. They're going to have a bunch of dumb...
Mr. President, thank you, Mr. President. I just wanted to follow up on that. Are you considering other travel restrictions, perhaps domestically, in that regard? Can you describe what type of...
Specifically from certain areas, yes, we are. And we're working with the states.
We're going to make sure that nobody can fly from California or Washington State to Washington, D.C., and that's basically it, because I am stupid.
And we are considering other restrictions, yes.
Reuters is reporting that you're going to extend the European travel ban to the UK and Ireland on Monday. Is that accurate?
We're looking at it very seriously, yeah, because...
They did, by the way. They already said they're going to. It's already been agreed. He's saying,
we're looking at it very seriously.
Pence in the same press conference right now, like 20 minutes later says, yes, we've added the UK and Ireland, which are not the same thing. To the travel ban, but we'll start. I mean,
they've had a little bit of activity, unfortunately. So we're going to be looking at that. We are actually already have looked at it, and that is going to be announced.
Yeah, then announce it. What the ever loving.
You just criticized the Fed yet again. If I could just get a little clarity on your thinking on this. Yeah. It's been a hallmark of your presidency. You're always going after the Fed. If you feel so strongly about it, why don't you dismiss the chairman, or do you think you're powerless to do so?
No, I think I have the right to do that.
Don't tempt him to do something else that wrecks the market in the middle of everything, you maniac.
The right to remove him as chairman. He has so far made a lot of bad decisions, in my opinion. We had this great, and we will soon have again, because I think you're going to have a tremendous bounce when this is over. I think there's a pent-up bounce that's going to be tremendous. I think you saw that yesterday with the stock market. No, I'm not happy with the Fed because I think that they're following that lead.
He's not wrong, and all of his buddies are counting on it. They are doing disaster econ right now. Dudes are sitting on their money, salivating, wishing that they could go back to, midway through the Obama administration numbers and reinvest capital.
Not leading. We should be leading. I'm not happy because if you look at the central banks of other central.
Don Gila's in our chat room. He already has the idea.
Central banks, largely they're lower than us, their rate, and their equivalent of the Fed rate is lower. In some cases by 2 points. In some cases, that's a lot. In some cases, very substantially. And I thought that the Fed would be and should be much more proactive as opposed to following. Our Fed is following. We have the #1 currency in the world by a factor of many times, as you know. We have the currency, we have the power, we have...
I got the power!
By far the strong currency. Also, you look at the dollar, the strength of the dollar. Our Fed is not doing what they should be doing. We shouldn't have a Fed rate that's higher than our competitor nations. You look at Germany.
Their currency is not as voluminous or has as much reach or stability as ours either. One of the reasons why people like and use the U.S. currency is because of its stability in comparison. And the other countries, when they're dropping the interest rate on the production, if they have a Fed-like system where there's an interest rate to creating new money, you're talking about economies that, like Italy's, which has 60 million people in it. That's just 50% more than the state of California. If you want to talk about the state of California having its own currency going forward, you have my number.
They're essentially under zero. They're negative. There are many countries negative. Japan is negative. Germany is negative. Others.
That's because they don't have the same system as we do, and they flood the market with cash when emergencies happen. And they've been rolling on an emergency since the 2008 crash, and they're still doing it for certain industries, and they're going to do it for this.
Are negative.
But they're also going to gut big parts of their social safety net in the process, and they're going to have to make cuts to them later.
And we're paying higher interest rates. And what I'd like to do is, frankly, refinance our debt. We could refinance our debt very easily at a much lower rate. We have some tremendous opportunities.
Because he's got the highest deficit ever and double what Obama's was.
Right now, but Jerome Powell is not making it easy. No, I have the right to remove. I'm not doing that. No, I'm not doing that. I have the right to also take him.
Phone's ringing. Powell just started coughing into a rag.
In a regular position and put somebody else in charge, and I haven't made any decisions on that. Okay? Thank you.
Bye. I gotta go. Look at that lumber.
Was your temperature normal, Mr. President?
Totally normal. I always run 102 degree temperature. It's a contraindication of Adderall. Jesus Christ.
Wasn't that wonderful? Aren't you all very lucky that His Majesty came out here, spoke to you? I mean, I'm enjoying the warm glow. I think it's a glow. It might be 101 temperature, but I mean, I hate to see him leave, but I love to watch him go. I mean, look at that. I mean, the view of him leaving is worth the broken heart I feel, but fantastic, wonderful work that he's doing. Yeah, he's going back to bed. There is no question. And here's the thing. Does he have COVID-19? I have no idea. But I'll tell you this. It sure as shit, everybody there is staying up extra hours because they're dealing with all this stuff. And it's, I mean, not the Senate, obviously, because Mitch sent them home.
Well, I don't know if you realize, but Saturday is my big leaf consumption day. And we can't have a vote on those days because, what would you do?
Hello, Mr. Vice President.
Well, good afternoon, everyone.
Don't start talking until I leave the room. I don't want to hear the bad words. Don't do it, Pensy. Don't say no. Oh, boy.
As the President just said, we just completed the White House Coronavirus Task Force meeting in the Situation Room. And
not the Oval Office where the President was, because we're trying to keep everybody from getting really sick.
Continue to implement the President's vision, not just for a whole of government.
Vision. That's right. He's got a vision for this virus and where it'll go. And his vision is very, I mean, you heard it. We want to get through this fast with as little death as possible. Keep the numbers low. And that's what we're shooting for. So we're rolling in. We've looked at the Chinese model, and we like the 24-hour crematoriums idea, and we're hoping that no one famous dies.
Response to the coronavirus, but a whole of America approach.
I said whole.
The focus of our task force today and going forward is on implementing the President's public and private partnership, on testing, focusing on...
So focus on those. Those are your big stock buy-ins, people. Big, you know what I'm saying. Yeah, pay into, Quest Pharmaceuticals might be your CVS, Walgreens, Walmart, and Target. They're going to stay open, if you know what I mean. Somebody else might take it on the nose, but the President says those are his Kramer stock picks of the week.
Ensuring that state and local authorities have the guidance and the support to ensure mitigation, particularly in areas where we've seen community spread. And we're continuing to lean in.
I said spread and whole. Mother is going to give me such a spanking.
At the President's direction on addressing capacity issues in our hospitals.
We heard all of his stuff
to
already.
Greens and Walmart, related employment interrupted
Money.
At this moment about the best guidance for every American.
Money stuff. Hey, let's drag him out here.
Just a quick review of the numbers as of late afternoon yesterday. Let me start off quickly globally, and then we'll go to the United States. Right now,
make sure you
there are
mention the
people out there
first
who are going to be impacted by this, but
So when we saw issues with testing, and again, I want to remind everyone, it was a surveillance system that was set up by public health institutions in the United States, our CDC, to be a surveillance test. We then, because there was no other, moved it to a diagnostic test. But now we have the full power of our testing capacity. What do I mean by that? We're looking at what it will take to have,
all right.
let's make sure
if
that
the Office of Pandemic Response had been left in the Oval Office, in the administration, that change would have happened 6 weeks ago. Oh, here we go. This should be good.
The cost for these limited situations will be taken care of by the federal government. And then finally, we wanted to think of, again, as I said, how do we deliver money to the people in the quickest way? We didn't want to take 6 months to implement some government system. So I want to thank everybody at the IRS. The way we're able to do this, again, the IRS will issue tax credits. For most employers, they'll just deduct the money from what they owe us. But I want to emphasize, for small and medium-sized businesses that have cash flow problems, we will issue guidelines. You'll be able to come to the IRS, get the money in advance so you don't have cash flow issues. So we were very careful in balancing, making sure that people...
If you have deductions, what if, all right.
got paid with not creating undue burden. We also will have unique circumstances where schools are closed. In many places...
Why is Steve Mnuchin telling us about school closures?
Parents may be able to telecommute and take care of their...
Some of you may have, like I do, a trophy wife who doesn't do kids, and she always makes air quotes when she says words like kids and children. And in that case, if you can't afford 7 nannies like we have, childcare might be
their kids and continue to get paid for their companies, but in certain circumstances that parents have to be home to take care of youngsters or elderly people, again, we wanted to ensure that they had the ability to do that. And as the Vice President mentioned, for kids that received meals in schools, the schools are closed. We wanted to make sure that those kids would continue to get lunches paid for.
That's not your say, Steve Mnuchin. That's in the Democrats' bill that they put forward and that got voted on and made it through the House and won't be voted on until Monday. That was not input from the White House. That had this team had nothing to do with that being added to anything. And states started doing that early. They started setting up systems before this. You're just cribbing from their stuff and having Mnuchin say it? Jesus.
I especially want to thank the task force. Two things that were very important to us in this. There's a provision as it relates to masks. We can now ramp up to 30 million masks a month. And we wanted to make sure there was free testing, but there's also a provision that the states will communicate back to CDC these results. So we will very quickly.
Oh, wait, what? So let me get this straight. The states, as they get positive results, will relay those numbers back to the CDC, will they? When did that start? What? Who's the genius that came up with? Was it you, Steve? Was it your wife? It was your wife, wasn't it? Your wife went, I think, it's let them eat cake. You can't say that, dear. Okay, how about letting the kids eat cake at home but not at school? Great idea. Yeah, they came up with this.
Get those results. Last thing I want to say is I thank the House for sticking around till very late last night at 12:30. I don't want people to be surprised. We will be doing a technical correction on Monday morning. Despite us working very hard, we had language agreed with the Speaker and with Kevin McCarthy. It didn't get into the final bill. Last night at 12:30, Kevin, the Speaker, and I agreed that they would vote on it and have an agreement there'll be a technical correction. So I don't want anybody to come back on Monday.
Technically, it's a small thing that we're not going to include comorbid people and diabetics and anyone with an income under $25,000, and we're just not going to include them in the free testing part. It's a technical thing, but my wife suggested it.
Morning and be surprised by that. So again, thank you to the Vice President and the President. And let me also just say, I would describe this as like a baseball game. The first inning was the $8 billion. This is the second inning. We have a lot more we need to do with Congress, and the Speaker and I have acknowledged it. We will be working.
This isn't the second inning. Your team didn't even show up at the stadium until the 7th inning. That's what this is. Jackass. You have to work hard when you've been sitting on your ass for weeks. Not impressed. Exactly. San Francisco just announced that libraries otherwise closed will provide childcare to healthcare workers. That's awesome. That's, again, a state thing, by the way, or a city thing in their case. President Gavin Newsom is doing great.
Doing a great job. We want to thank President Gavin Newsom for thinking of all the stuff so I could take credit for it later.
Starting immediately.
By the way, I don't blame Fauci for blowing smoke up Trump's ass every single time he's on camera with him, because if he doesn't, he'd have been fired in the middle of this, and they would put, he'd try to get Dr. Phil on.
The airlines industry in particular, no different than after 9/11, has a very unique circumstances. The cruise industry, the hotel industry, I would say we got a lot more work to do, and we very
have Mr. Bean in charge of the economy.
Much appreciate the bipartisan support and anticipate rolling things out very quickly.
Thank you, Mr. Secretary, and I know the President
loves you.
Say again how grateful we are for all of you.
So great. He loves it so much when you bring your wife around, and he wanted me to tell you he doesn't apologize for any of the stuff that he said to her 8 minutes ago. She's in the Oval Office right now, but you can't leave.
Efforts on behalf of the American people. Acting Secretary Chad Wolf is going to speak about cruise lines, the current suspension of travel, and the expansion to UK and Ireland. Mr. Secretary.
Thank you. Good afternoon, and let me start off by thanking the partnerships that we have with our private sector partners, both in the airline industry and the cruise line industry, for implementing a number of travel restrictions and security orders over the last several weeks and months. As the Vice President and the President have outlined, we have issued new directives denying foreign nationals who have been in certain affected countries, that's been 28 countries to date, from entry into the U.S. At the President's request, and again, as the Vice President outlined earlier, we've had a number of major cruise lines that have agreed to suspend outbound trips.
They were already planning on doing it.
Department of
Europe
Homeland
was telling
Security,
them to
men
do
and
it.
women of the department who are working day and night, 24 hours a day to implement these restrictions.
No, they're not.
And to make sure that we
They're
do
sleeping.
this in a
They're going home for 6 to 8 hours. They should. You should have two people working on the program together, leaving notes for each other so that everybody gets enough sleep, because if they get sick, the whole thing falls apart. You don't have people running in 24-hour shifts. That's dumb. I'm not impressed. I am not impressed by somebody working 24 hours a day on something. That's ridiculous, especially when it's a healthcare situation. If you're trying to catch a murderer, fine. Tell me that you're barely sleeping and you're sleeping in 2-hour shifts just to get it done. But if you're trying not to get sick from a jackass boss who keeps shaking your hand even after everybody's told him not to. By the way, we're never going to hear the results of Trump's test.
Around infection control practices. We have now come up with some very specific guidance.
Okay. Surgeon General.
Oh, God. Surgeon General.
Thank you.
I want to thank the
Yesterday
President
was
for being
very big, a very important day for our nation's providers and for our nation's patients in terms of the emergency declaration and also in terms of the agreement with the House that Secretary Mnuchin negotiated.
I like him. I like him. He's got like a thin, bald Mike Tyson vibe. Like the way he talks. He sounds like Mike Tyson, which sounds really fierce and masculine, and bossy and cool and New Yorky and a little bit Marlon Brando-y, and that's awesome. Let him talk.
I want you all to understand some straight talk from the nation's doctor. We really need
He means him, by the way.
you all to lean into and prioritize the health and safety of the American people. No more bickering, no more partisanship, no more criticism or finger pointing. There'll be plenty of time for that, but we all need to hit the reset button and lean into moving forward the health and safety of the American people as our top priority. More stories on how people can protect themselves.
Tell the Republicans. Even during the criticisms that the Democrats have had, all their criticisms would lead to better outcomes and better behaviors. The criticism has been self-isolate, get more tests out. You're not doing it fast enough. Those criticisms have actually shamed the president into actually doing this stuff. Don't pull any punches. I would recommend everybody continue to shame the president and this administration into behaving like adults and making this work harder. You don't get any credit until this is all done. If we have to wait to call you out on stuff, you also have to wait until you pat yourself on the back. How about that, you creep?
More people on how people can get the resources that they need that we've unleashed from the federal government and state and local governments. Less stories looking at what happened in the past. Again, there'll be time for that. I want you all to understand, as Dr. Fauci said, this will get worse before it gets better, but we are making progress to flatten the curve. We are making progress. 3 important points. Number 1, almost all people will recover. 98, 99% of people.
That's not true. That is not true. 80% of people get through this without it. 20% go to the hospital. The 20% that require intervention, they'll recover, but some of them have pancreatic damage. They have permanent lung scarring. If they have other problems,
will recover. People need to know that. And we heard a great story on NPR this morning about an 89-year-old from that nursing home facility in Seattle who is recovered. Number 2, we must lean into protecting the most vulnerable, those with chronic or severe medical conditions, especially seniors. Now is the time for us to lean into that, and we are taking the measures to protect them at HHS.
Isn't lean in one of the big feminist hashtags? Isn't it? Just a weird borrow.
Secretary Azar, Bob Kadlec, Bob Redfield, Admiral Chawla are hard at work right now, leaning into that from the federal level, but we need your help. Social distancing and mitigation, they're not to protect the 30-year-old or the 20-year-old from getting coronavirus. They're to protect your Nana. They're to protect your granddaddy. They're to protect the people who you love in your lives, and we need your help. And finally,
and just because the average age is older uh, stop telling people it's just about old people, because anybody with a comorbidity issue is going to be affected by this. You jackass. This has to be, yes, you have to talk about old people, but you also have to talk about anybody who has previous underlying medical concerns and especially immunodeficiency. All right, they're not even mentioning that part of it. It's because, and people are going to say, well, old people are going to die anyways, so why am I worried so much? And then they're going to go out and spread it to somebody who is 35 and has a genetic lung disorder, because they're idiots. Thank you,
All
Michael
have a
Anderson.
role to play. If we are complacent, selfish, uninformed, if we spread fear and distrust and misinformation, this situation will last longer and more people will be hurt.
Yeah, go into the Oval Office and tell him.
We pitch in and we share the facts, we will flatten the curve and we will overcome this situation. So finally, my prescription: know your risk, understand your circumstances, and get the facts to protect yourself at coronavirus.gov.
Well done, John. Thank you.
Which only updates Monday through Friday until 5 o'clock, and any of it that changes over the course of the weekend, just put a blindfold on and walk across the freeway for 2 days straight, hoping you don't get hit by a car, because you saw what the traffic lights and the on-ramps were on Friday.
And Secretary and Dr. Ben Carson.
Dr. Ben Carson.
Thank you.
Thank you, Mr. Vice President.
Cough
sometimes you have
right into his hand. Jesus.
to stop and think about what's unique about the United States. And
I'll never forget a story my granddaddy used to tell me about an old man who used to whittle, and he'd have a piece of straw in his teeth. And America was, has anybody got a banjo? Back me up.
one of the things that is really wonderful.
I love his rakish leaning style. Just let me just sidle up to the podium in the middle of an epidemic and spin you a yarn.
We should stop and think about more often is that we have so many people who are willing to put aside their self-interest for the good of the nation. And I want to thank those people.
Yeah,
at the
those people
federal-
who don't cough into their hand and don't touch their face and then touch a common surface. Those folks, those people, they deserve a round of applause. Why is no one clapping at me?
state and local level who've put their own lives on pause in order to try to help their fellow Americans. It makes
The
a big
president should
difference.
be golfing right now. He should be golfing right now. And he's not, because America.
But just as importantly, I want to thank the private sector.
Oh, they're moving in.
There are so many in the private sector who have volunteered their services, who have stepped up, who are willing to recognize
Who are
that-
willing to be a part of fixing this, because on the one hand, they don't want to be on the wrong side of this curve. They would rather their customer base not die. It's a little hard to sell a TV set to a dead person. And if they don't step in right away, the reaction later when this all upends is, where were you? What were you willing to do? Like, this is like cause marketing 101.
that maybe they're going to take a bit of a financial hit, but they recognize that we have to create the appropriate environment so that everybody can succeed in this nation.
No, that's not what's happening at all. None of these mask companies are giving free masks, for Christ's sakes. Dude, Jack Ma from Alibaba is donating 500,000 masks.
And so often we overlook those individuals. I want them to know how much we appreciate them.
Yeah, thank you, Buick Chrysler, for your upcoming coronavirus white sale.
We're facing now is a significant threat. You know, as a physician and as a surgeon, I faced a lot of very, very complex problems. And most of them we were able to overcome, not so much because of me, but because of the fact
But in
that we
spite
have
of me.
incredible people working on this together.
That's right.
It was
All the people who stuck the hose in the patient's nose after I accidentally severed their spinal cord. All the
teamwork that made the biggest difference in the world. And
Nothing was better
that's
for
what I'm seeing.
nothing worked better for a patient that I had that was dying of an aneurysm, but for Target to make jeggings available at half price for a weekend.
Here in the government right now, the people behind me with others who are willing to work together.
By the way, Housing and Human Services, like he's in charge of HUD, right? Like Housing and Human Services, like what? Come up there and talk about rent and how people are going to pay it.
As a team to be able to accomplish the goals for the American people. And I used to think we had long hours in medicine, you know, working 24 hours straight and working at midnight, 2 in the morning. This team is working that way too. I frequently get calls at 9, 10, 11, midnight about putting together some policies, doing various things. And I just want to thank all the people who are involved. And I hope that
Why?
we as a
Why would you need to call him to put together policies? What's the benefit of calling him at 10 o'clock at night, any given night, about a policy that they're going to put together? He doesn't know. He has nothing to do with the actual response. It's not his department, and they haven't added anything about like rent support or any of that stuff. That's the House throwing that stuff in. The White House is against it.
Nation can use this as an opportunity to pull together for good. You know, President Trump is going to be recommending a National Day of Prayer.
Oh,
And,
okay.
you know,
That's good. Okay, finally we get to the real crucials. Like, pray you can make your rent payment next month.
Gotten away from prayer and faith a lot in this country. There's nothing wrong with godly principles, no matter what your faith is.
No, there isn't. That has nothing to do with this. That, honest to God, if you want to bring out the chaplain, or a representative of, as part of the team, like we're going to deal with groups of faith because a lot of families are putting their kids, churches are opening themselves up to take care of kids while people have to work and all that kind of stuff. Like, do that. What the hell does that have to do with his job? And what does his job have to do with this? Nothing.
Loving your neighbor, caring about the people around you, developing your God-given talents to the utmost so that you become valuable to the people around you, having values and principles that govern your life. Those are things.
That's the problem, guys. The reason we have a coronavirus spread is because you guys have lost the entrepreneurial spirit. That's your problem. That's why. That's why all this is happening to the president. Do you not realize what the man is going through? The president is doing all this stuff because you guys won't do 10 pull-ups.
Things that made America zoom to the top of the world in record time. And those are the things that will keep us there too.
What?
Thank you, Mr.
Pray for America to be more entrepreneurial in the middle.
Secretary. Okay, question.
Mr. Vice President, first of all, can you explain why Secretary Azar is not here? And also, can you indicate to us...
Because he's sick.
One of the things the president rolled out yesterday was discussion of Google partnering with the federal government, and then...
Which was bullshit.
Later, Google said it was not aware that this was going to be announced and that it was not prepared in the same way the president forecast to the country. So here's the discrepancy about the website, Google's involvement, and why is the Health and Human Services Secretary not present?
Secretary Azar was at the coronavirus task force meeting this morning. He's back to work, and we'll have a changing roundup for these presentations, so we can get quickly to your questions. But
he was sweating too much to be on camera.
And working 7 days a week for the American people and making a difference.
Wow.
With regard to Google and other private partners, I know Google issued a statement that they are planning to launch a website. I think they gave a date of Monday, March 16th, We're working literally around the clock, and I know that our whole team working on this public and private partnership.
Oh, so basically, Google was planning on putting together like a massive tracking AI situation for the disease. Apparently, is that what we're getting at? Is that what's happening? So Google is planning on putting out a constantly updating page for their own, and the White House found out about it and wanted to claim credit for it. And that's this whole public-private partnership thing. Although they forgot to tell the privates that they were partnering with them. Oh, mother's going to be upset.
Couldn't be more great.
I couldn't be more grateful to be partnering with other people's privates. It's really, I mean, if you know, if Armageddon doesn't give you a pass, mother, nothing will.
Grateful to all of the hardworking people at Google that are helping to put this website together. But tomorrow, 5 o'clock, we'll have very specific. We'll have very specific description tomorrow about when the website will be available.
Bob Kirksey says, and the Google project is for the San Francisco Bay Area only. Right.
Parking lot sites will be available for people to be tested, and we're working right now with state and local communities to determine where it's best to roll those out. There's a number of.
Here's a good idea. You don't have to work with the states and local governments for that. You know exactly where the most deaths and the most infections have been. You start there. You cascade out from the impact point and all major travel points from there. So bus, train, and train stations and airports. You put those in the residential areas surrounding those places, and critical care, hospice, and old folks' homes. You put them around there, and then cascade out as available from that point, so that the hotspots get coverage, so that people can find out whether they're infected or not, and then sequester themselves until the virus spread slows in their area, and then they can go back to normal. How about that? How about you don't have to coordinate at all? How about just friggin' learn to read? This is, I mean,
a number of communities are already doing a great job.
If I was Google, I would sue the Trump administration after this is all over. Because the damage done to their reputation by it seeming like they're not doing something, or that they break down or don't meet a commitment that they had made, which is what the president effectively said, that they're making a commitment to do something that they're not committed to doing.
Job meeting their needs, so we're trying to flow the resources. But 5 o'clock tomorrow night, we'll have details.
5 o'clock tomorrow night, we'll have details about when the website might be up, wherein you could kind of look to see at the coronavirus.gov site if and when we will have parking lot places available, and if those people, Jesus Christ.
Yes, please.
Can you tell us whether you have also been tested for the coronavirus, and can you or somebody else clear up the apparent discrepancy between the letter that was issued from the White House physician's office just before midnight last night, in which the physician concluded that you and the president did not need to be tested?
Well, I know the president announced that he has been tested, and I'm going to speak immediately after this press conference with the White House physician's office. At this point, as of last night, the White House physician's office had said that neither I nor Mrs. Pence either had the
In a Sparks administration, everybody on my team would be nose swabbed on camera.
Symptoms or the contacts that would necessitate testing. And maybe I might ask Dr. Birx to step up. As we expand testing across the country, we want people to be able to go to a website. There'll be a questionnaire there to determine whether or not a test is in order, because we want to make sure that people are being tested that have the symptoms.
They are developing is in its early stages and will be limited to the San Francisco Bay Area. That seems very different from what you and the president are saying.
Well, what Google said was that they're planning to launch a website this coming Monday, March 16th, that will enable individuals to do a risk assessment and be scheduled for testing at pilot testing sites in the Bay Area, with the goal of expanding to other locations. And we're very grateful for that. The objective here is to have a website.
You bastards lied. Google built something that sprawls out from the epicenter of their business domain to areas that will affect them to help them track who's sick and who might come to work and who won't, because they have a ton of on-site people who can't work from home, especially people who monitor all the stuff that gets thrown on the internet at any given time that might be terrorist activity, like and that punches up and messes with their SEO stuff.
Website up very quickly that that first people in
Liar.
areas that have been deeply
Mother would not
impacted.
approve.
Washington State, California, New York. Now we've seen community spread in Massachusetts and also Florida. And so we want to make sure that we're flowing those resources as well as those remote testing sites in that area. But that's a statement I was handed this morning from them. And again, I want to tell you folks, we're working 24/7 on this. We're going to have very specific details.
No, they're not. No, they are not. The website itself does not update with the most recent cases, deaths, areas all weekend long because they stop at 5 o'clock on Friday.
Out of this new public-private partnership and testing at 5 o'clock tomorrow. Please.
Thank you, Mr. Vice President. Could you give us more details on the potential financial assistance for the entertainment industry, for the cruise industry that the administration is looking at right now?
The event industry here in Vegas is getting wiped out. Large scale shows are being wiped out. Like as a stand-up, I'm a little more nimble in when I can get back up and running. But if this affects, if you've got multiple people in a show and you have to shut down for 3 months, those people aren't making a paycheck. And then what happens over that time if one of their relatives dies because of this and they can't perform because of it? If they're unable to go back to work because of that, because of the emotional impact, because that's the kind of work you do. Like the rolling effect on the entertainment industry and especially the hospitality and event industry is going to be brutal
right now. And if I may, on the temperature checks, were all of the members of the cabinet who were in here today, did they also have their temperatures checked? And okay, I see you nodding.
By the way, all the reporters who are in there had their temperatures checked when they came in. I don't know if some of the seats are missing, it's a little more vacant than usual because people, the reporters are social distancing and they figure they can watch this on screen. They don't need to, because if they're not going to be able to ask a question, these are only the people who ultimately get their questions answered who are there. Everybody else who sits in the back and just takes notes and is a writer, for example, never gets called on because they're too far back in the room. There's no reason for them to be there per se because mixing with people, shaking hands, going through the whole process. And some of them may have not been allowed in because they had fevers.
But is it also the White House policy now that anyone who, for instance, comes into the Oval Office needs to have their temperature checked at the door?
I'd refer those questions to the White House Physician's Office. I have been informed that they're establishing new protocols for temperature checks, and I had my temperature checked too. Let me ask the Secretary of the Treasury to address what may be the next few innings. I mean, as I thought.
Has everybody had their temperature checked? Yeah, let me talk with the dude who is in charge of the stock market. Speaking of temperatures that we care about, are we giving enough Tylenol to the stock market right now to bring its fever down?
Secretary Mnuchin put it very well. We got the initial support, $8.3 billion from the Congress. The House passed legislation to act on the president's priorities, but we understand the president's made it very, very clear, whether it's our airline industry, our cruise industries, that we expect to be coming back to Congress to make sure that as we put the health of America first, and as businesses make those hard choices, to make a priority of the health of their employees or of those that they serve, their customers, that we're going to make sure that they can come all the way back.
Let me say dollar stuff.
So let me just emphasize, this is a unique circumstance. This isn't like the financial crisis where people didn't know how long this was going to go on. And let me just say, there's no question, because of the things that were requested.
We don't know how long this is going to go on. Thank you, James Etling. He says, if it comes to it, President Pelosi can right the ship and probably help stabilize the markets. Yes, she's older, though. She needs to stay healthy. They need to quarantine her right now. And don't get me started on Ruth Bader Ginsburg.
people to do, there are parts of the economy that are shutting down or slowing down dramatically. And as I said before, and I said yesterday, we are committed to use all the tools and all the resources of the government to make sure that we protect the economy. So many of the industries that you've talked about, as I said, the airlines are the most obvious because we have a unique circumstance where we have shut down travel, and these are
Understand this real quick. Let me be real clear. Since Munchkin is talking, there's a unique and specific difference between this and the 2008 financial crisis. The 2008 financial crisis, which wrecked businesses all across the board, stopped lending and all this stuff, had to do with failures within that very industry. As an external factor, this is impacting all industries nearly equally, and its recovery will also come back nearly equally. They are counting on this. The people who will be most affected are not in their care range, but he's not wrong. The stock market will rebound and probably overshoot, and they may want to be timing this out. They may withhold certain packages just so that the bounce they know is coming happens closer to the election, so people go, look at the stock market. Why would we want to jump ship? Never mind the fact that they're not counting on the fact that hundreds of thousands of Americans are going to die. They just think it's going to happen over a slow enough roll you won't notice.
These are of strategic importance to us.
I did say much.
We appreciate there's many industries that are impacted.
Because he's tall, but I'm talking about his brain.
Impacted by this. I would also say there's many individuals. The president has talked about a stimulus program, whether it's through a payroll tax cut, whether it's through refundable tax credits. We are 100% committed, and I can assure you there is bipartisan support. So we have a lot of tools. The Fed has a lot of tools. Some of these tools we don't have that we had in the financial crisis. We'll be going back to Congress. And one of the reasons why this bill was so important is this is just now the second step on bipartisan support. We will make sure that the economy recovers out of this and whatever support.
Yeah, there are elements of this they've been waiting for. Everybody's been talking about a coming recession. That's a natural part of the expected arc of the economy right now, which, by the way, I call BS on. I don't think that models we've been using for a long time apply to a modern economy this way. There are other factors that make this whole reset that they think is necessary is a myth. It's garbage economics from when there were half the number of people on Earth that there were. Tom says, I disagree, Hal. I think it's going to trigger a deep recession. It will likely last a couple of years at least. I don't think you're wrong. I think they're playing on the idea that there'll be a stock rebound.
Money, if I may follow up.
And the payroll tax cut is just garbage. That's just them trying to, cut the Achilles heel of the Social Security Trust Fund.
How much more money would you like to see? I'm not talking about the previous bill. I'm talking about in the future for those industries.
$500 billion minimum by August. They're gonna pump another $500 billion in, or they'll do another 300 right before the election, and people will start, pushing back. Yes, and I do understand, Amy. Fear not.
Let me just comment. It would be premature to comment on specific money, as I said. I'd use the analogy of we're in a baseball game and we're in the early innings. We have 100 different things that we're looking.
It's a stupid analogy. They keep using it.
Looking at yesterday, the president announced on student loans suspending interest. That was one of the things he announced using.
It doesn't change the fact that you have payments. It's only the ones that are financed through the government.
The strategic oil reserve. This is a great time. We also have a unique circumstance having nothing to do with the coronavirus. Parts of our economy are very much impacted by the temporary low price of oil. So the president, the vice president, and everybody else is 100% committed. We got 100 different ideas, and whatever we need to do, we will do.
I'm just going to get the hell out of here.
So much. I have a question for you, and if I can, for Dr. Birx. First for you, sir, if I may. Your language has changed a bit. You've tweaked it a little bit. Early on, you said that there was a low risk for the average American to contract the coronavirus. Right. Recently, your language has altered a little bit. You're saying the risk of a serious illness remains low.
Yeah, that's how it always was, because he screwed up the first time he talked about it. But that's the issue. 80% of people will recover, but during the time they have it and they go through it, and at the tail end of it, they could still pass it to people.
Can you address why
And the more of those people think, oh, it's fine, it's no big deal, I'm just going to get a lighter version of it, the more people they pass it to who will experience the more egregious version of it. Jackass.
change is the potential of contracting the virus for an average American no longer low? Why the change, sir?
Well, I'm going to let Dr. Birx address that, because the reason we're...
Language, sir, and you are the vice president. If you don't mind, sir.
Everything that we are communicating to the public is based on what is the unanimous opinion of our health experts based upon the information.
No, it's not. No, it's not. The contagion aspect of this thing has been the same ever since. You have been mixing the language of severity of illness with the contagion factor since the start of them talking about it. And by downplaying the severity aspect of it, you've made it sound like anybody who has it isn't passing it along during that period.
That we have at the time. It's now a little more than a few weeks since we had our first instance of community spread.
Not at all, Amy. Don't worry about it, please.
And letting the American people know the president took every step to prevent the coronavirus from coming into our country.
You did not take every step. That's just dumb.
I think you can't overstate how unprecedented and extraordinary the suspension of all travel from China was when the president made that decision.
It wasn't a suspension of all travel. There were still cargo and dock workers who were coming ashore. There were still business people who got an exemption. You're still allowing people to come from Beijing into the country. It was based on Wuhan initially. Stupid.
Before the end of January. And the travel advisories with portions of Italy, South Korea, the screening of personnel coming into our country. But allow me to let Dr. Birx address that, because what we're going to continue to do is tell the American people, straight from the health experts, the best information that we have to see to their own health, the health of their family, and their community. Dr. Birx?
Not mentioning truck drivers at all.
So
Super
every
important.
day we
You're absolutely
analyze
right.
data from around the world and look at age groups that are impacted.
This is just dumb. This is smoke. The contagion aspect has always been the same. The death rate was even argued about initially, but everybody knew that the initial numbers were downplayed and that we're closer to the Italian numbers were much closer to reality as far as the fatality rate untreated of this disease. And they intubated a 20-year-old 4 days ago. I haven't heard the updates since whether he's surviving or not, but it was that bad.
Look at and try to get a sense of the amount of asymptomatic patients. Now remember, all of the groups that are doing screening are screening on symptoms. And so we're trying to figure out, based on that information and based on the profile of the epidemic, to really understand, is there a whole group under 20 that really doesn't get significant symptoms, yet we don't believe that uniquely people under 20 are naturally protected from the virus. So are they a group that are potentially asymptomatic and spreading the virus?
Yes, they are.
Because of that, and because of that unknown.
That wasn't an unknown. That was never an unknown. It is specifically why why the Chinese government was sequestering people. Wow, thanks, Steve G. 141 patrons. We're getting close to that 500 mark. Again, thank you guys immeasurably. I have stuff that I want to mail out to you guys, but I am hesitant to do it for all kinds of reasons. I may send you something that I've touched that gets to you fast enough where it's a factor, or the mail person might not know that they've touched something else. They've touched a mailbox or whatever. That's going to be on a delay for a little while until I can figure out another system. We will get you patches and all that kind of stuff in this process. And yeah, there's also a very special thing that's going to our patrons who've been with us for a year. It's very special. It's going out soon. That's all I'm going to say. So if you've been with us for a year, you're getting a special surprise soon as I can start mailing things again. Thank you, Rob Glenn. And I hope you're okay, brother. Check in with me. Text me. You good? All right. I don't know if you're watching, but if you are, salute and yeah.
We don't want to say that the risk is low when we don't know how low the numbers are for people who are asymptomatic.
But you were saying it. You were saying it. You were saying it when you did not know. You were not taking the abundance of caution necessary, and you weren't paying attention to the actual spread numbers in the other countries while you were telling people that it was no goddamn big deal. Holy smokes. Thank you, Tom Hebert. I appreciate that for the Hal Sparks Truth Serum Fund. I feel like, all right.
We have a good sense of the number of people who are having symptoms, and we have a good sense of who is deeply impacted by this. I mean, if you look at all the data coming out of all of the countries that we triangulate on a twice-a-day basis, people of a certain age are at higher risk for a worse outcome, and that's why we have been so laser focused on that. But the other side of the epidemic is how much transmission.
Right.
And until you really understand
That was the problem, because your initial language didn't address the transmission aspect of it.
How many people are asymptomatic and asymptomatically passing the virus on, we think it's better for the entire American.
Which I was talking about on the cruise ship in February. In February, this was known. I cannot stress this hard enough. All of this stuff that she seems to be talking about, like, well, we're just finding these things out. All of this was known 2 months ago.
American public to know that the risk of serious illness may be low, but they could be potentially spreading the virus.
It could be. They are. They are. That's why it's so dangerous. Because of the asymptomatic spread, because people don't know they're passing it because they don't have symptoms, which is something the jackass president doesn't recognize when he's like, I haven't really had any symptoms. I don't know why I should get a test. I'm fine. I just feel a little run down and a little hot. You have a Diet Coke?
Virus to others. And that's why we're asking every American to take personal responsibility to prevent that spread. And that's why we've made all of these recommendations broad, even past people who have symptoms or no symptoms, because we need to have everybody taking precautions.
Yeah. Now, and that was the question they asked you. Why has your language changed? And the honest answer to why has your language changed is because you were ignoring the truth, and now it has caught up with you and bitten you in the ass. Bitten? Bit you in the ass. I don't think there's a smitten, bitten. We'll figure it out.
Speaking to all of the governors, are we
Monday?
Oh, Monday. I'm sorry.
Yeah.
So
Yeah, but I'm not going to talk to them today. I mean, it's Saturday. I mean, everybody's on the golf. Why would, I wouldn't even bother the president with this. He's in the Oval Office napping.
to speak to all the governors. Are we looking at any sort of domestic travel restrictions that could be coming down the pipeline anytime soon?
We're looking at a lot of things. We're looking at a lot of, the president said we're looking at a lot of things, and so we're looking at a lot of things. They're considering a lot of things, and we're considering them. But we'll consider it if it becomes a thing we need to.
And my other question for you is Leader McConnell's statement saying that he was going to read the bill, that he was going to speak to some of his members over the weekend. Are you confident that the Senate's going to take up this House legislation and get it done quickly?
Well, the president expressed strong support for the legislation. It received a very large bipartisan vote in the House. But we respect the process. I'm grateful for the support that Leader McConnell has expressed for the process. And the
Leader McConnell, who is he here? Is he around?
I'm due back at the reptile center at the Louisville Zoo. So I can't be there for the vote because Sunday is lettuce cups.
priorities that the president has outlined. We'll be working with members of the Senate to unpack the bill for them and why President Trump endorsed it yesterday, and we believe that they should move it expeditiously to passage.
And on domestic,
With regard to additional travel restrictions,
in the U.S.
let me just say, as the president said, we're considering
a
broad range of measures.
Well, yeah,
but no decisions have been made.
We haven't.
But I
We're considering a bunch of stuff, but we haven't taken action on it because we want to squeeze every last dime out of this before Armageddon. Because apparently you can buy your way into the velvet roped parts of hell.
just want to assure the American people of two things. We're going to continue to follow the facts. We're going to continue to
Yes,
listen to
they're going to follow the facts. They're going to be behind everyone else's reading of the facts.
the experts about recommendations.
It's almost over.
We'll bring, as we did this week when the president made the decision to suspend all travel from Europe. We'll bring the best recommendations.
We'll bring up, when the president said, "Oh, we're going to suspend all travel from Europe and leave the UK," and because the Irish people are very important to the part, and then someone told him that Ireland is not part of the UK, and then we changed that once he found out that that Ireland's not part of the UK, that we're going to block the UK and Ireland.
Of our healthcare experts to the president, and I promise you, and I promise the American people, this president is going to continue to take every step necessary to protect the American people and put the health of the American people first, and together we'll get through this. Thank you.
What's being done to help those in public housing during this coronavirus? What's being done to help those in public housing?
Ben Carson, isn't that what I do? That's what I do. I forgot to mention that when I was talking about how we should all pray and how America's awesome. I left that out. Jesus. Walkout.
A lot of things are being done.
What is anything being done for the people who are actually suffering from this? Nah, not so much, bruh. Sorry. Christ. And that's amazing. Once Bitten, Twice Shy is the song that you're thinking of. Chat room. They're using it for political advantage. Why the focus is on oil? Because people like cheap gas. They are true to their word. They are followers. Right. They're just following, what everyone else. Northern Ireland is part of the UK. Right. That's the big mix up. But isn't
the southern part of Ireland closer to the British people? I don't understand. I fell asleep 10 minutes into Braveheart. I don't watch movies with anyone who has a better shoulder to hip ratio than mine, which is why I love Jabba the Hutt.
You have to know what kind of cattle antibiotics to use and how much to take because some have live viruses in them. It will kill you if you take the certain kind. Medicine is one of them. Wow, well, that's important information, safety information there. Thanks, Egon. Amy, that will be incredibly useful information. We'll have a powwow. We'll have, as long as the internet's still on, we'll have an apocalypse powwow. If everything starts to go to hell though, and it looks like stuff is cratering, I'm basically gonna arm myself to the teeth and drive to one of those missile silos that rich people have bought and turned into homes, and we're just going to take one. I apologize to the family or the two weird hippies that live in one, but we're taking your space, and I'm bringing everybody in my all my Patreons, and anybody who's got one of these or a symbol therein can get in, and we're gonna it'll be like an arc. That's what I'm gonna do. It's gonna be like, all right, everybody, we're going to Montana. Here's the address. See you there. Prepping collards for cooking, as you do. How the second person invested in Rochester, New York was a school teacher. You Pizza the Hut, right? On my way over, don't forget the black vinegar. Will Nerd Halen play there too? Yes, all the Nerd Halen people will be there in 01, and all my favorite band members will be allowed in. There'll be a list. You guys are all on the list. If you've been in the chat room more than 5 times, you're on the list. You'll be in there, and immediate family members only. You can even bring one rude family member that you barely talk to at Thanksgiving, but that's it. We got to draw a line somewhere. The place is only so big, and then we're sealing the top and eating beans for the next 3 years. Okay, Wes, you're not coming to the missile silo. Would you mind standing guard outside for in shifts? We'll pay you in toilet paper. What do you say? Correct. Last year, this time we only had 6 Patreons. Look at the increase. I know, Billy. It's incredible. Like I was, at the beginning of this, I was looking at all the different uh, media groups, and from like TYT to Jordan Peterson to all these online people who were using it to build their show and build it up and all that stuff. And I had kind of just let it sit for a long time and not really tried to grow it. And so just through the effort of doing it, it's really turned into something. And I appreciate you guys immensely for being a part of that, for listening and knowing that, and I having done the show for free for a decade, and paying for all the gear in it out of my own pocket, asking for that seemed a little more natural after a while. But yes, patreon.com/halsparks if you have the ability to do so. If anything is tight, do not worry about it. And if you are one now and that's an issue, please, you're forgiven if you have to take a powder for a while. I appreciate it. If you want to come back strong later, that's awesome. If you want to make up for lost time after this passes and you just are nervous about it, I understand. I mean that sincerely, and I adore you guys, and I appreciate your support. If you want to be a patron and you do the $5 or $10, $20 level, and it's like a couple cups of coffee a month, and you can afford that, greatly appreciate it. But if you cannot, I completely understand. I just mean, um, I was just saying that, like, if all these right wingers were ended up funding their little media empires and able to build a show where they could stay on and do all this stuff, um, I felt, and I was having a hard time talking anybody on the left side of things into doing it, because the majority of the people who were really taking advantage of the Patreon stuff were all on the right, And thank you, World Peas. We will give Peas a chance. Thank you for the super chat. That actually monetizing the show. I was trying to tell people about it before I had even tried it, before I had even started pushing for it. And I was having a real hard time getting it across because I hadn't done it and I didn't know what it entailed. So by going through this, world peace, by going through it and making the effort, it makes it easier for me to make the case to Steph and others, and Jackie Schechtner and Frangela, when they have their own stuff, to try and build it into something, and then eventually that becomes the network that we all benefit from. That's not just the fringes of the world taking their case to the people, but people who are reasonable and helpful and kind and all that. Those folks, us, Steph and the Mooks, Frangela, Jody, John Fugelsang. Like, if the idea that if there was a point where through Patreon and super chats and other services that people could, help support the show in a way that, like, at this point, Steph has, they're on Free Speech TV, and they get, what they get versus what they give is really bad. I would much rather her have a successful online YouTube presence, supported that way, than through Free Speech, because they can't even promote the Sexy Liberal tour on Free Speech. It's just, it doesn't work. So, but until I make this a success and show people that it's a viable option, a lot of them are just hesitant. So that's really the reason why I started jumping to this. Thank you, character punching the air with a fist and bump. Oh yes, thanks for the fist bump, Patricia. This is, this is partly the future of how this stuff runs, and because, thank you, Thomas Rock, clean your room. All right, I will. Yeah, I'm going to be doing that. We'll all have a little bit of free time. But in all honesty, us being able to turn this, into something that, it's never going to be profitable like regular broadcast news. But if you can make your living doing this, and you can bring this and grow this together, then the chance of an Air America kind of structure building on YouTube or other sources will actually be viable, and you don't need these, you don't need to, go hat in hand to the Tom Steyers of the world. because you can be small and nimble, like, and I know I have other resources in my life as a touring stand-up, obviously not right now because but I have a son and I have a family and I have to provide him with health insurance and all that kind of stuff. And that's where my income from the road goes. And so to finance the show through other means and being able to go, okay, this sustains itself on its own. It doesn't even have to make a profit really, just pay for itself. If it does that and we can grow it into something valuable, then we can go, okay, this is the methodology. Frangela should have a show on the air and it can cover all their costs and everything. The profit of their life comes from the other stuff they do because then they can make more appearances. They can grow their stuff. How about get real Art Bell up in here, right? If you need some antibiotics, let me know because you weigh about 160 pounds. You can take about 10 cc's and chem 3 cc's. If it gets bad, let me know. I will. You will be absolutely be hearing from me if that is the case. How profitable do you think it's been for Rogan? Through the roof. I mean, the dude's house is enormous. He's rich from it. Millionaire. And I'm not even asking it to be that. I just wanted, have wanted it to sustain itself and grow itself into where the production value and the available technology that we need as it changes over time, it can kind of care for itself. So it's not even that I'm, looking to turn this into the main aspect of my life. It's just that it doesn't take away from food I would rather be putting in my kid's mouth. You know what I mean? That's always the thing. So in terms of that, and I don't know if the buffering is us, but that's why. And I appreciate you guys jumping on board and being a part of that. It means a lot. And that's why I'm trying to grow it into this. It's, and again, I think I'm in a unique position to say this, and that if it is an issue for you, don't take part. If it is possible for you, then please jump in and support this, and then I can make the case better and better that we could create a kind of compounding effect where we grow these extra shows and kind of group them together. And the Housebarks mega media empire, mega worldwide. It's not as impossible an idea as it once seemed for this kind of media. Having been at Air America, when they were having a rough spot and knowing that they were counting on investment financing for most of what they were doing, and they were being undercut at every turn by the Bain Capitals of the world and these other investment groups that were screwing like radio stations all over the country to make them drop the progressive angle. I've heard Stephanie promote the tour on free speech. She can mention it. They can't run promos, is my point. So there you go. Hal needs to be in public office as soon as this pandemic is over. That's the next phase. That's definitely a part of this. I mean, at the very least, having a sense of strategy going forward and going, okay, we know where the problems are. We know what the known unknowns are. And you set up a system wherein you can respond to those kind of things. I'm going to sign off for now. I adore you guys. Thanks for sticking around. I will be back later. We'll do another midday because I know a lot of people are stuck at home. So go have a meal. Check the news if you want to raise your blood pressure. I'll do what I can to come up and do a little bit of entertaining later. We'll stick to some of the news of what's going on, but I'll try and make it as funny as possible while keeping you informed, so that we can cut the tension a little bit. That's that'll be kind of crucial going forward. So I adore you guys. Please take care of yourself. Take care of somebody else. Stay hydrated. Stay well fed. Take your immune supplements. Make sure you're getting plenty of vitamin C, vitamin B, and vitamin D. D is the one that seems to be effective, making sure that your D levels are up, and not getting a bad version of this disease. That may have been why the 89-year-old lady who got it, who made it through, was able to do that. It was the amount of vitamin D in her system. And as we sequester ourselves in our house and we're not getting enough sun, that's part of the factor. We're not producing enough vitamin D in our bodies. So even if you have to socially isolate, go outside for a little bit, get a little bit of sunlight, read near a window, whatever it takes. But I will see you guys in a little bit. I adore you. Thanks for sticking around, and we'll see you in a bit.